All right, let's go.
Okay, I want to welcome everybody to this morning's SHEV meeting. We're meeting obviously by Zoom, and I want to thank the governor and the General Assembly for, particularly the governor and General Assembly, hopefully in the future may modify this, for allowing us to participate by Zoom. I'm asked to read this language pursuant to our authority to operate by Zoom, so I'm going to do that. Due to the pandemic, we're able to conduct SHEV business remotely without a quorum assembled. To expedite the remote meeting, I have the authority to suspend committee meetings until further notice, as all such action items addressed in this meeting will be taken by the entire body. This meeting is being recorded as required by 2020 Acts of Assembly, Chapter 1283, Item 4.0.0.1.g. A copy of the recording will be posted on the SHEV website. And then also want to modify the meeting by moving the nominating committee report to the end of the agenda. So with that, we've got first item is to approve the minutes of January the 7th, which was our last meeting in person. And we're going to vote on that by block, but we'll make the motions by the respective parties making the motion. And first is the Academic Affairs Committee meeting. Is Mr. Ampey on board?
Good morning, Chairman Fralin.
Yeah.
The Academic Affairs Committee met on January 7th. The minutes are included in our packet as item 2A. If there are no additions or corrections, I'll make a motion that we accept them as presented.
Okay, and is there a second?
Second.
Second by Katie. Okay, Resources and Planning Committee meeting. Mr. Slater. You need to unmute, I think, Tom.
I'm trying to get the thing unmuted, but
I understand. I have the same problem.
she's not wanting to unmute. Here, oh, Lord.
You're good.
Okay, Mr. Chairman, the Resources and Planning Committee met on January 7th, 2020. The minutes of the meeting are in our board book at page 7 and following page. I would move the approval of those minutes.
Second.
And who seconded? Bill?
This is Bill.
Yeah, okay. Bill Murray seconded. All right, and then the third item is the council meeting minutes, which I will move the approval. Is there a second?
Second.
That's Bill Murray, a second. And we will vote on all three approvals. All in favor. We have to have a roll call vote for every action on a Zoom meeting. So Katie, would you call a roll? Oh, not Katie, but Leanne. Katie's the secretary, but Leanne's gonna call it.
Mr. Ampey?
Aye.
Dr. Adkins? I don't think she's here. Ms. Connolly?
Aye.
Ms. Harker? Mr. Fralin?
Aye.
Mr. Holloman?
Aye.
Mr. Light?
Aye.
Dr. Murray? Dr. Murray?
Aye.
Ms. Radcliffe? Aye. Dr. Ramsey?
Yes.
Mr. Slater?
Yes.
Ms. Webb?
Aye.
So the motion passes by unanimous approval, and the minutes are approved. And now we will move to our speaker. And as you know, we have been hearing from researchers throughout the Commonwealth, and today we're very fortunate to have one of the leaders in research in the Commonwealth of Virginia, Neil Cassell, who has been at the University of Virginia for a very long period of time. I remember in 2004, when I first became a member of the UVA Board of Visitors, he was a legend already at the University of Virginia Medical Center. And if there was one person that everybody knew, it was Neil. And he has, since this time, been very focused on research in the focused sound arena and has done a great job with that and is a world leader in this research. So Peter, would you please introduce Neil, and I look forward to hearing from him.
Thank you, Mr. Fralin, and we're delighted to have Dr. Cassell with us today. He's the founder and chairman of the Focused Ultrasound Foundation. He's also, as Mr. Fralin indicated, the former co-chair of neurosurgery at the University of Virginia. He's published more than 500 scientific papers and book chapters, and his research has been supported by over $30 million from National Institutes of Health and industry grants and contracts. He's a member of numerous medical societies in the United States and abroad, and he has served on many standing and ad hoc committees at the National Institutes of Health, editorial capacity for a variety of academic journals, and much, much more. I think we're in for a very educational session today, and so I'm delighted to turn this over to Dr. Neil Cassell.
Neil may be muted, Peter.
Checking with Kristen.
I am working on it.
So Dr. Cassell, we do have your
They
presentation
said,
material up. We just can't hear you.
he said he was on. I just, let's try that. Whoops. Dr. Cassell, are you on? I can't, oh, yes, now he is. Nothing.
Can you hear me now?
Yes, thank you.
Okay. Thank you very much for the generous introduction and for the opportunity to share the Focused Ultrasound story with you. I know this is Chev, and I will spare you my opinions of higher education, perhaps for another time. So, Tony, it's not. So Thomas Jefferson said, without health, there can be no happiness. And what we are all about is improving the health and happiness of millions of people around the world with a wide variety of serious medical disorders by creating a revolution in therapy using an amazing new technology called focused ultrasound. And focused ultrasound is the most powerful sound you will never hear, but it's a sound that someday could save your life. Focused ultrasound is an early stage, totally non-invasive therapeutic technology that is a disruptive, highly disruptive, game-changing alternative or complement to surgery, radiation, a new way of delivering drugs and of stimulating the body's immune response to cancer. Being non-invasive, it can be performed on an outpatient basis with no incisions and less pain and fewer complications such as infection and hemorrhage and collateral tissue damage, leading to more rapid recovery and improved outcomes at a lower cost. So some examples, this in the bottom pane is a 64-year-old left-handed architect whose career has been compromised for more than 10 years by essential tremor affecting his left hand, his dominant hand. And you can see his attempts at drawing in the pane above, not really good for an architect. So he was treated with focused ultrasound. Immediately before the treatment, this MR scan was performed, and it shows that blue dot in the middle of his brain is the target of the abnormal nerve cells that are firing away uncontrollably causing the shaking. So he went into the device and the target was treated with 1,024 intersecting beams of ultrasound energy. At the end of the treatment, his tremor was completely gone. The target was totally obliterated. He could draw for the first time in more than 10 years. And this video here shows that at 3 months later, he has absolutely no tremor. Now, it doesn't take an enormous leap of faith to appreciate that if there's a technology that can be used to treat something deep in the brain with a high degree of precision and accuracy in an awake patient through the intact scalp and skull, that same technology can be more readily used to treat things that are outside of the body, like tumors of the breast, or tumors in more forgiving locations, like the liver. So this is a young woman with a gigantic uterine fibroid. Uterine fibroids are benign tumors in the wall of the uterus that are not uncommon in young women, but very, very rarely do they get to be this size. And it was obviously impacting her marital life as well as her work life. She was offered the standard of care, a hysterectomy, which is a big operation, 5 to 7 days in the hospital, 4 to 6 weeks to recover. No more uterus, no more children. Instead, she chose focused ultrasound, which was an outpatient procedure. She went home the same day. She returned to work in 2 days. And here you can see her 9 months later, after the tumor, which had been killed by the ultrasound energy, had been absorbed by her body. No incisions, no drugs. This is an MR scan of a young woman with breast cancer. She was offered a surgical lumpectomy. She did not want a scar and a dimple in her breast, so she chose focused ultrasound, a 1-hour outpatient procedure. Essentially nothing more than a non-invasive lumpectomy. And this is a 7-year-old girl in London who was struggling with incapacitating, intractable abdominal pain and renal failure from this enormous benign tumor that was filling her pelvis. She was operated upon, but the surgeons had to abort the procedure and back out because the tumor was too bloody. On a one-off, purely experimental basis, because she was so desperately ill, she was treated with focused ultrasound. And it took about 4 hours to destroy approximately 60% of the tumor. In 2 days, her pain was improved. In 2 weeks, her renal function returned to normal. And she came back 6 months later, and the majority of the remaining tumor was treated. And as she grows up, she can be retreated again and again. So the way focused ultrasound works is analogous to using a magnifying glass and focus beams of light on a point and burn a hole in a leaf. But instead of burning a hole in a leaf with focused beams of light, with focused ultrasound, multiple beams of ultrasound energy are focused using an acoustic lens on targets deep in the body with a high degree of precision and accuracy, sparing the adjacent normal tissue. And at that focal point where the beams converge, we now understand 18 ways in which ultrasound can affect tissue, in contrast to radiation therapy that only has one mechanism of action. The fact that there are so many different ways that focused ultrasound affects tissue creates the opportunity to treat a wide variety of medical disorders. And the point in the body where the ultrasound is focused, is targeted and controlled and guided and monitored by imaging, either ultrasound or in this case, MR imaging. So this is an MR scan of a patient with a metastatic brain tumor. The tumor is targeted, the treatment is planned, and the magic is that you can actually watch the effect of the tissue, of the treatment on the tissue as it's being administered in real time. In contrast to radiation, where the effects of radiation are invisible while the treatment's being administered, the effects of focused ultrasound are immediate and verifiable. And in radiation, it takes weeks or months to know whether it has had an effect. Now, this slide, complicated slide, makes 2 points, and I think you have a printed version of this or an electronic version. So the first point is that look at the large number of clinical indications, medical disorders that are in various stages of research and development and commercialization around the world. Today, there are more than 130. 10 years ago, there were only 3. So a large number and a rapidly increasing number of clinical indications. The second point is that most of these are in early stages of development. Around the world, of the 130, only 30 or so have regulatory approval. In the US, only 5 or 6 FDA approvals. And in the US, to date, only 2 or 3 have any type of insurance coverage and reimbursement. And this is just a manifestation of the fact that the field is young and that there's still a lot of work that remains to be done to bring these indications across the finish line. Now, when you see 130 indications, it stretches credibility. It sounds too good to be true, like snake oil, good for whatever ails you. But to be sure, focused ultrasound is not a silver bullet, and it's not a panacea. It's not for every patient, and it's not for every indication. And again, more work needs to be done to sort out where focused ultrasound will provide unique value in the therapeutic armamentarium. Because of the potential impact of this amazing technology on so many patients around the world, there's a lot of impetus to make it available in the shortest possible time. Saving time, saving lives. Saving time, saving lives. The problem is that the evolution of any new disruptive therapeutic technology, from idea and laboratory research to widespread utilization as a standard of care, is a glacial process that often takes decades. The gamma knife was invented in 1950, and it didn't become mainstream until 1995. And the reason is that the process is very complicated and involves a large number of really difficult steps that have to be accomplished by a bewildering array of organizations that have different agendas and timelines for decision making. And in addition, there's a list of fairly daunting impediments, including lack of awareness among patients and physicians. It's been called medicine's best kept secret. Long-term, rigorous scientific evidence. Regulatory approvals are a lengthy process. Insurance reimbursement is a huge challenge. Physicians as a segment of society are amongst the slowest to adopt new things, and fairly vicious turf battles that develop between the different medical specialists. So when we first became involved with this field 14 years ago or so, we cast about for a playbook or a model that we could follow that would shorten the time from laboratory research to widespread mainstream utilization, saving time, saving lives. We couldn't find one, so we were obliged to invent one. So the focused ultrasound, that was the genesis of the Focused Ultrasound Foundation, which is a unique medical research, education, and advocacy organization that was founded in October 2006 as a 501c3 tax-exempt organization. It is a highly entrepreneurial, high impact, high performance, high technology service organization. And we're based in Charlottesville, Virginia, but we have assets in Europe and in Asia. A couple of years ago, Charity Navigator recognized the foundation as one of the top 10 medical research organizations in America. And a couple of years ago, the Darden Business School and the Batten School of Leadership and Public Policy teamed up and wrote a case on the foundation as an exemplar of a unique social entrepreneurship model. The mission is simply to accelerate the development of focused and adoption of focused ultrasound. Our major activity is to organize and conduct and fund research. We're interested ecumenically in all of the indications, all of those 130 indications. But where our team concentrates their efforts are on the brain indications, Alzheimer's and Parkinson's disease, OCD and depression, pain, stroke, epilepsy. And a major area for us is cancer and cancer immunotherapy, especially glioblastoma, pancreatic cancer, melanoma, breast cancer, and veterinary indications. A couple of years ago, we had the idea, I don't know why it took so long, that the technology is developed and tested in animal models of human disease. And then it's been used in humans. But heretofore, it's not been used in animals with naturally occurring disorders like tumors or arthritis. So we've started to treat companion animals, mostly in partnership with the Virginia Tech Vet School, with the idea that we now create a virtuous cycle of animals helping humans, helping animals, helping humans. And this is a dog that had an oral melanoma. It was scheduled to have half of its mandible removed, instead was treated with focused ultrasound, totally non-invasively, one treatment. We educate fellows and interns from around the world. Our website is widely recognized as the Encyclopedia of Focused Ultrasound. We have fairly frequent webinars on topics of interest to the focused ultrasound community, focused ultrasound and psychiatric disorders, focused ultrasound and cancer immunotherapy. And our newsletter comes out twice a month, and we will try and sign you all up to this. Every 2 years in the DC area, we host the largest and most important meeting of focused ultrasound. A year ago in October, we had 450 some people from 23 countries, 250 presentations. The next one is scheduled for November of this year, and there's a pretty reasonable chance that it will be held online. During the year, we organize several invitation-only small workshops where we bring together individuals from industry, academia, FDA, NIH, and so on, clinicians, scientists, physicists, business people, with the intent of developing a roadmap of technology development, preclinical laboratory studies, and clinical trials that will most rapidly lead to a new indication in the shortest possible time. Awareness of the potential of focused ultrasound amongst all of the stakeholders is essential for advancing this field. So we engage in a variety of activities. This presentation to you all is an awareness event. We have a very aggressive media placement program, print, broadcast, and digital. We have assembled the most astonishing team of superstars to advance our cause. We have about 40 people, 6 MDs, 6 PhDs, 6 MBAs. Everyone is a superstar. We built the team with the philosophy that A's attract A's and B's attract C's. And today, as a result of a rather draconian ongoing reconstructive pruning process, the team is populated entirely by A players. The board of directors can tell you a lot about the character of the organization. In the interest of time, I won't go through their individual bios. I encourage you to look them up on our website. But the important point is that this is not a typical philanthropic board. No one is obliged to donate to be on the board, and there is no social cachet, none whatsoever. So it's truly a corporate governance board that represents the interests of the stakeholders. The board is fully engaged, and I assure you it could go toe to toe with any Fortune 50 company. So what we do simply is invest our donors' money in a variety of activities that overcome barriers and shorten the time from laboratory research to widespread utilization as a standard of care, saving time, saving lives.
When I first heard I had Parkinson's, I was very surprised. I always thought of it being an older person's illness, and I've always seen people in wheelchairs, so I thought I was going to lose all my mobility. Basically anything that required movement, I couldn't do it. My leg would bounce uncontrollably. It would hyperextend and actually lock backwards. It was very, very painful. I couldn't walk, so I had to be taken in a wheelchair to the hospital. With each treatment, I could feel myself getting stronger and stronger. My symptoms were getting less and less, and my pain was getting less. Then the clinical trial director, she looked at me and she says, "Get up, you can walk." And I thought, I can walk. It was amazing. I got there in the wheelchair, unable to walk, and immediately following it, I walked to the room. It was a miracle. The focused ultrasound treatment has given me back my life. I've been able to go on walks. I've been able to run. Being able to ride my bike again. It's a miracle.
So at the end of the day, what we do is take our donors' funding and use it to create focused ultrasound, which results in miracles, as you just saw, that transforms disease into health and happiness for millions of people, in alignment with Thomas Jefferson's ideas, millions of people around the world. So Virginia is on the frontier of focused ultrasound research and development and patient treatments. There's robust activity at Virginia Tech, at the Brain Institute, Biomedical Engineering Department, the vet school, and Carillion is getting ready to start patient treatments. The state funding issue may have slowed that down a bit. UVA has been involved with the pioneering work on brain indications, essential tremor, and Parkinson's, and epilepsy and pain. And arguably, UVA is the leading site in the world for focused ultrasound in cancer and cancer immunotherapy. The state has provided generous support ever since continuously since the Warner administration. There was $6 million in this year's biennial budget. We'll see what's left at the end of the cuts. And Governor Northam has been an absolute champion for the technology, and in fact is giving the keynote speech at our next symposium in November. So sooner or later, every one of you, or a loved one, or a friend, is going to develop a disorder which could be treated with focused ultrasound. Think about that and give us a call. Thank you again for the opportunity to share this story with you.
Thank you, Dr. Cassell and Mr. Fralin and others. I'm sure there are questions from the group.
Yes, thank you, Neil, for that presentation. And it was, it's just amazing what you've been able to do in such a short period of time. And I know it seems like a long period of time to you, but it's in the research world, clearly a short period of time. But Peter, I do think we need to take questions if anybody wants to ask Neil a question. And so I'm going to let you handle the answering questions because it's easier on focus ultrasound, on Zoom for you to do it.
Okay.
Questions? Peter.
Okay, I'm looking around to see who's raising a hand. Dr. Cassell, if you could take your image off the screen and then we can see the council members again.
Okay, look, let me get our tech guy.
While Neil's doing that, I will tell you.
Yeah, we're okay. We're good.
Thank you.
While Neil's, can you hear me, Peter?
Yes.
While Neil's doing that, I will tell you, just to give you an indication of just how well thought of his organization is. Charles Steger was serving on his board at the time of his death, and it's rare that you see two universities in cooperation like that. But Charles was extremely fond of Neil and what he was doing. Questions, anybody?
Yeah, this is Marge. So Neil, thank you very much. That was some amazing stories in there. So this is a foundation and a nonprofit. How can you or do you leverage the private sector and some of the commercial businesses to try to increase the opportunity here?
That is a terrific and very timely question. So in order for our vision of focused ultrasound treating millions of people around the world, you must have successful commercial organizations to manufacture and distribute the equipment. So part of our mandate is to facilitate the success of the commercial sector. So one of our programs or initiatives is called FUS Partners. And there are currently 55 manufacturers in the space. 10 years ago, there were 5. So FUS Partners connects these manufacturers, those manufacturers that are in need of financing, with sources of capital. Sometimes it'll be some of our donors, but more it's the venture capital or strategic investors. So we make those connections. We make the connections between manufacturers and other companies for strategic purposes, and we make connections between the manufacturers and the academic institutions for technology transfer. And in fact, at our upcoming board meeting on June 10th, we're going to present 3 options by which the foundation can more effectively facilitate the commercialization of the technology. Maybe it's setting up a sister venture fund or other things. There's a lot of options, but it is front and center of our thinking and the efforts that we've taken to date. For instance, we helped Coke Disruptive Technologies make a multi-$100 million investment in an Israeli company, Insight Tech, and we facilitated it by doing the due diligence, et cetera.
Other questions? Okay, hearing none. Neil, again, thank you for that wonderful presentation. It's just amazing what you've been able to accomplish in this short period of time, and we're very proud of you.
Well, thank you very much, and thanks for the opportunity. And I will tell you that I'm as an academic, and I've got a bunch of them in my family, my hope is that COVID is going to catapult higher education from the 12th century into the 21st century.
Thank you very much.
Okay.
Thank you very much, Dr. Cassell.
Okay, moving right along on our agenda. The next item is the receipt of report of the agency director. Peter?
All right, thank you, Mr. Chair. This picks up on page 37, and I'll just highlight a couple of items. You have it all, so I don't want to read it to you, but it is kind of a remarkable moment to look back on March the 9th, which was when we had a public event of our Outstanding Faculty Awards. The governor attended. I think that ended public events in the Commonwealth that week. But it was a great celebration. We had a number of folks participate in it. Mr. Fralin, Ms. Connolly, Mr. Light, Dr. Murray, and others. So we had a really good day on March the 9th. I'm glad we were able to celebrate our faculty from across the Commonwealth. I wanted to mention the Tech Talent Initiative. You have heard, of course, that the governor and the General Assembly rolled back just about all the new spending in higher education, nearly $400 million in new spending for higher education, had to unallot that money for the biennium. One item in the budget that the governor and the legislature did preserve is the funding around the Tech Talent Incentive Program. This was the initiative designed around the Amazon expansion in Arlington, and the Governor General Assembly held that money in the budget, so the institutions that participate in that program, and it's just about all of them, will get the funding in order to hire the faculty, outfit their labs, continue to grow those programs in computer science and related fields. I mentioned the General Professional Advisory Committee. That's our regular meetings with the presidents. We have suspended the in-person meetings, and in fact, the presidents are meeting via telephone or other technology weekly now, at least weekly, sometimes more than weekly, and I participate in those calls at least every other week. So we're on a regular relationship with the public college university presidents. You may have read in the paper too also that the governor and Secretary of Education have formally launched a secretary's task force looking at COVID-19 related issues, particularly what are the conditions under which schools, K-12 schools, pre-K-12 schools, as well as higher ed can reopen. And so I serve on that panel, as does Marianne Radcliffe, as well as a number of college university presidents, both public and private. So we will have a very aggressive meeting schedule here over the next several weeks to try to come up with something that can help colleges, universities address many of those issues that you heard arise on our call with the private college presidents yesterday. I do want to mention the Medical Reserve Corps. This is something that Governor Northam established, it had been created, but he activated it in a large way by calling for students enrolled in our colleges and universities to volunteer for the MRC, the Medical Reserve Corps, to help support the community in the event of some kind of public health emergency like COVID-19. And so our staff has been actively involved with the Virginia Department of Health on identifying, entering into databases, checking the credentials, those kinds of things of people who have applied to participate in the MRC. So I just wanted to commend our folks, Lynn Seifert and Emily Salmon and Young Jung, who did a lot of work on this to to work in cooperation with another state agency. Another thing we had to suspend was the Higher Education Equity Summit. This was something the governor and Secretary of Education and the Director of Diversity, Janice Underwood, had helped coordinate and lead, and we expected to have 200 to 300 people. We had to suspend that. We were able to have a high-level teleconference with our college university presidents and others back on April 27th to continue the conversation around talent and inclusion and equity. And those conversations will continue under the leadership of Paula Robinson. This whole COVID thing and the new ways of using technology has led to a lot of discussion around distance education, online learning, remote learning, those sorts of issues. And you've read, and we've talked about it at our April meeting. We had a board meeting of the Online Virginia Network last week that has some purview in this area, and under new leadership now with Speaker Fillercorn taking over as chair and several new members. And so that could be a source of some new ways of thinking about online education, and that will be something I'd like to bring to the council, not just Online Virginia Network, but other ways of remote learning, bring that to the council for a further discussion in July. It would be a good time, I think, for that conversation. I do want to mention our management fellow, Grace Wheaton. I think she's on the call. The Management Fellows Program, we now have had, I believe, Grace would be our 4th management fellow. These are I think of what Neil Cassell just said about A's attracting A's. These are all A's. These young folks who are coming in and serving in state agencies, and Grace is our most recent one. You will have a chance to meet her virtually, if not in person, at some point in the future. She'll be with us for about a year. I wanted to mention a couple of retirements that we have on our staff, and Sylvia Rosa Casanova, who leads our private post-secondary education unit, is stepping down on June the 1st. And so Sylvia is on this call somewhere, and I certainly just want to give a real salute to the work that Sylvia has done. You ask her what she does, and if you boil it all down, it's protecting students. It's making sure that students are not taken advantage of in any way by institutions that are seeking certification to operate in Virginia. And we have a couple of people who are a little more challenging than others, and Sylvia is the gatekeeper for a lot of that, and we're very grateful for Sylvia and her team and all her efforts for a long time in public service. So Sylvia, congratulations and thank you. Lee Rung, all of you know Leanne Rung. She'll be retiring sometime around August the 1st. I'm not sure how her vacation is going to work into this. Lee, I haven't talked to you absolutely about this, whether you'll participate in the council's July meeting or not, but a shout out to Lee Rung, who has been really the anchor in this organization through a lot of transition over the last 15 or so years. So hats off to you, Lee, for just years of tremendous service to the Commonwealth and to Chev. So. And then you may have read in the paper this morning that John Broderick, the president of Old Dominion University, has announced that he will be retiring sometime in the summer of 2021. And John's been president of Old Dominion University now for 13 years. And he came from Old Dominion. And so he understands the mission of the college, university, understands that community like few others, and has embraced it and modeled Old Dominion on to be one of the finest urban serving institutions in the nation. And so I don't think John's on the call, but I did want to give a special recognition. All of you know John Broderick and the great work that he's done at Old Dominion University. Attached to my report, picking up on page 40 and then going through to page 43, are the reports that Joe DeFilippo and Wendy Kong prepared that they would have presented in the committees, which of course are happening simultaneously with this meeting. So I do just want to make sure that in addition to my report, that you take a look at what Joe has prepared, his staff report, and then Wendy's report. Just a couple of things out of Wendy's on page 43. One relates to the 6-year plans, and these are the opportunity for the Capitol Square folks to come together to meet with the institutional representatives. We had our big meetings last year where we met with every college university president and senior staff on their vision for the next several years, including their budget requests for the biennium. We did that this year as an opportunity to revise the plans. In a COVID era and all the uncertainty, we're having some conversations to figure out exactly what we want to ask the institutions to present and in what form. So we will be having a meeting of the what we call the OP6 groups with the cabinet secretaries, director of planning and budget, staff directors of the money committee, and the SHEV director meeting this week to begin those conversations and figure out the best way to engage the colleges and universities in these uncertain times. We also were assigned a number of studies during the legislative session, and some came with money, others did not. We are going to step back and assess what our capacity is, given the resources that we have, but there are a couple that are mentioned. This is on page 43. I just want to call your attention to the second phase of a financial aid study. You may recall the first phase modified the allocation to institutions. Now we're looking more closely at how institutions award the aid to their students. So we looked at it at the state level to the institutions last year. This year, the legislature has asked us to look at how institutions make the awards to students. Legislature also had some language around a funding study, as well as looking at how institutions spend their money by academic program and discipline, trying to do a kind of a real-time assessment of the value of these different kinds of study in this time. I mean, 4 months ago, that might have made perfect sense to do these things exactly the way we had planned. I think we need to step back in the post-COVID era and looking at with the financial challenges and the budget challenges that the institutions will be facing, and figure out the best way to approach these studies. And again, we always welcome input from council members on how we frame these issues. All of this, let me just conclude by talking about the Virginia Plan for Higher Education. We had made a lot of progress on updating the plan and looking at the measures and targets one more time, and we revised the council priority initiatives. We were going back and trying to streamline some of the language to make it more focused. I think we have an additional opportunity and requirement necessity that we do that now. And so while you don't have a Virginia Plan presentation in this agenda book, Mr. Chair, it is something that is very much on our minds. And we will be coming back to this in July with perhaps a modified approach to how to make changes to implement, bring up to date the Virginia Plan, given all the circumstances that have transpired over the last several months. I kind of galloped through that, Mr. Chair, but I'd be happy to go back to any piece of it and take any questions or any input from council members. Thank you. You are muted, Mr. Chairman. Haywood, we're still not hearing you.
How about now? Can you hear me now? I think it automatically mutes you if you don't speak in a certain period of time. So maybe that's what's creating the problem for everybody. I remind everybody maybe that they need to check the mute before they speak. The next item on the agenda is taking up some action items. First, with the Academic Affairs Committee. And so Ken and Joe DeFlippo, do you want to make a presentation of these action items, and then we will have a roll call vote on each of them?
Good morning, everyone. Thank you, Mr. Chairman. Do come before you with some action items from the Academic Affairs Committee. The first is action item 6A, and this is action on new programs at public institutions. We have 4 programs for the council's consideration this morning. There's a Bachelor's of Exercise Science at Old Dominion. There's a Master's of Data Analytics at Old Dominion. Master's of Athletic Training at Radford, and a BS in Finance from BCU. Dr. DiFilippo can give us a little rundown and a little information on those programs. And then as the chairman just said, we'd like to vote on all 4 of them as a block, given that we are doing a roll call vote. But Joe, do you care to share any info with the council?
Yes, thank you, Mr. Ampey. Can you hear me okay?
Yes, sir.
All right, thank you. I'll be very brief. There are 4 programs here for council's consideration. These new degree program proposals are coming through council's old process. The new process initiated with the March agenda book with 23 program announcements. Those will come through the pipeline for council consideration in October. So for the time being, we're flushing out the system. Well, no, that's not quite the right word. We're proceeding with the work in the old system, and these 4 degree programs come in under that. The first item, Bachelor of Science in Exercise Science from Old Dominion University, that educates students for entry into the fitness industry and also constitutes preparation for graduate work in a variety of allied health disciplines such as occupational therapy, physical therapy, etc. Also from Old Dominion University, of Master of Science in Data Science and Analytics to educate students at an advanced level to utilize programming tools to do statistical models to support analysis of data sets. From Radford University, the Master of Science in Athletics Training is necessitated by the athletic training profession's move to the graduate level for accreditation. So council members may recall we've had several of these. All of the athletic training programs are going to have to move to the master's level in order to maintain accreditation and prepare their students for the licensed profession of athletic training. And then finally, there's the Bachelor of Science in Finance from Virginia Commonwealth University. That program trains students for entry into financial planning and analysis in various organizational settings, and also constitutes preparation for graduate work in finance and business. And staff recommends that council approve the 4 resolutions on page 46 in the agenda book as a block. Thank you, Mr. Ampey.
Okay, Ken, do you make that motion?
I do, Mr. Chairman. I move that we accept all 4 programs as presented by staff.
And I second it.
Okay, we have a motion by Ken and a second by Katie. Any discussion? All in favor of, or excuse me, roll call. Leanne, please take the roll.
Mr. Ampey?
Aye.
Dr. Adkins? Ms. Connolly?
Aye.
Ms. Harker? Mr. Fralin?
Aye.
Mr. Holloman?
Aye.
Mr. Light?
Aye.
Dr. Murray? Dr. Murray? Ms. Radcliffe?
Aye.
Dr. Ramsey?
Yes.
Mr. Slater?
Tom, you're on mute. Tom?
What's up, guys?
Mr. Slater?
Can you hear me?
Yes.
Yes, I vote yes.
Thank you. Ms. Webb?
Yes.
All right, thanks everyone for that.
Okay, is there another item, action item, Ken?
Yes, sir. Action item 6B is an action item on bachelor degree programs and teacher education. You guys may recall this is to help with the teacher shortage. We have 7 programs before you coming from 4 different institutions. We've had some of this last year, but here's some additional programs. Joe, you care to add anything to that?
Yes, thank you, Mr. Ampey. I would just point out to council members that this item follows on the 2018 General Assembly's action to enable bachelor's degree programs in education to serve as teacher preparation programs. Prior to that point in time, as per State Board of Education policy, students generally had to complete a subject matter undergraduate degree. This change was instituted in order to help with the teacher shortage, as Mr. Ampey mentioned it would enable or foster more four-year completion programs for teacher preparation. Last year was the first year that the new enablement was in place, and so we established a special process to enable public institutions to secure approval from SHEV rapidly, so that they can then also secure the necessary approvals from the State Board of Education. And council members may recall that last year around this time we approved 25 programs for public institutions. So we still have some, but the number's dwindling. The four institutions on the docket are James Madison University, Longwood University, Norfolk State University, and the University of Mary Washington. If council members look at the table that accompanies the agenda item as an appendix, you will see in there both the degree program for each institution, as well as the initial license and endorsement that that program will lead to. And then in each case, a projection of the increase in teachers prepared as a result of establishing this program. The totality of increased teacher production on an annual basis from these four universities as a result of these particular programs is estimated to be approximately 100 additional teachers per year. So that is the intended effect of these programs going toward alleviating the teacher shortage. Staff therefore presents for council's consideration the roster of degree programs on page 65. And we recommend that council approve the resolution there, which would constitute a blanket approval of those 7 degree programs. Thank you, Mr. Ampe.
Okay, Ken, do you make a motion to approve?
Yes, sir. Marge, yes.
I'm sorry, Marge, I should have asked for discussion. I apologize.
There's just, Joe, we had the OECD work that we did not too long ago that looked at what Virginia's doing, what CHEV's doing, et cetera. One of the comments in that report that I thought was interesting was that we have a relatively low employment rate for people who have an education background, which just seems to be, a contradiction to the notion of teacher shortage because we don't have qualified people. I believe that we have teacher shortage of a sort. So I guess I'm actually in favor of these programs because I think the direction that, in general, these are going is the right thing to do. But I guess I continue to be concerned that these moves won't actually solve the real underlying problem that creates, quote unquote, a teacher shortage.
At the risk of answering without being an expert on that particular problem, I would say I agree with you. These programs are going to be helpful, and it will be helpful to the students to have a genuine 4-year pathway. It'll save them some money, and it'll enable them to get further. It is not going to solve the teacher shortage problem. The teacher shortage problem is a workforce problem. The number one issue there is to pay them more, I think. And the General Assembly and the governor were on track to do that before we entered the era of COVID-19. So we're going to be set back.
I actually am in favor of this, but probably for a different reason, right?
It's a difficult thing, and I think the pandemic is going to make it more difficult, at least in the short term.
Any further discussion? Okay, Ken, are you ready to make a motion?
Yes, sir. I make a motion that SHEV grants approval to the institutions listed to implement the specific bachelor degree programs for teaching education for fall of 2020.
And I second it.
Okay, we have a motion by Ken, second by Katie. All in favor signify by, let's take a roll, excuse me. Yeah.
Is everyone muted? Okay. Mr. Ampe?
Aye.
Dr. Adkins? Ms. Connolly?
Aye.
Ms. Harker? Mr. Fralin?
Aye.
Mr. Holloman?
Aye.
Mr. Light,
Aye.
Dr. Murray, Dr. Murray,
Aye.
Ms. Radcliffe,
Aye.
Dr. Ramsey,
Aye.
Mr. Slater,
Aye.
Ms. Webb.
Aye.
Okay,
That's 10.
motion carries.
All right.
And you have another item, do you not, Ken?
Yes, sir, Mr. Chairman. Item 6C is an item action for private post-secondary institution certification. Staff brings before council 2 certifications, one for Eastern Nazarene College, which is seeking its initial certification to operate in the Commonwealth, and Southside College of Health Sciences is seeking a new certification due to a change in ownership. The staff does recommend these for approval, but Joe, do you care to add anything?
Yeah, thank you, Mr. Ampe. You've captured the essence there. Eastern Nazarene College is an out-of-state school coming in from Massachusetts. They are accredited by the New England Regional Higher Ed Accreditor. Southside College has existed in Virginia for some time. They've recently been purchased by Bon Secours, and that change of ownership necessitates by law that they come before council for recertification. Because again, according to law, certification is not transferable in Virginia. Both school applications have undergone the usual review by staff and for quality and financial stability. And thus staff would present for council consideration to approve as a block the 2 resolutions that appear on page 68 in the agenda book. Thank you, Mr. Ampe.
Okay, any discussion before we take a vote on this? Okay, Ken, would you like to make a motion?
Yes, sir. I'll make a motion that council certifies Eastern Nazarene College to operate a degree granting post-secondary institution in the Commonwealth, as well as Southside College of Health and Sciences to operate a degree granting post-secondary institution in the Commonwealth, both effective immediately.
I second that motion.
Okay, we have a motion and a second. Leanne, would you please call a roll?
Mr. Ampe,
Aye.
Dr. Atkins, Ms. Connolly,
Aye.
Ms. Harker, Mr. Fralin,
Aye.
Mr. Holloman,
Aye.
Mr. Light,
Aye.
Dr. Murray, Dr. Murray,
Aye.
Ms. Radcliffe,
Aye.
Dr. Ramsey,
Yes.
Mr. Slater,
Aye.
Ms. Webb. That's 10-0, 10 in favor, 0 opposed.
Okay, the motion carries. Ken, do you have other items?
Yes, sir. 6D from our packet is an action in the process to revoke Medical Learning Center's certificate to operate. This is not voting on us to revoke today, but to start the process to allow staff to start the process. The school has refused to cooperate with Chev's acknowledgement of some violations, and the staff recommends that we start the process. Joe, you care to add any additional context to that?
Yes, thank you, Mr. Ampe. I'll very briefly, as Mr. Ampe distinguished just now, the resolution here is for council to authorize staff to initiate the process for revocation, not the actual revocation itself. So the school will have an opportunity to defend itself through all the various processes that the Administrative Process Act provides for them. I will not belabor the entire history of Chev's interactions with Medical Learning Center. They're in the record. I would just point out the crux of the request for this action at this time is the Medical Learning Center's failure to provide Chev staff with information requested for an audit. The Virginia Administrative Code specifically states that grounds for revocation include failure to provide information related to school operations. So staff intended to conduct an audit at Medical Learning Center in January of 2020. They announced that intention in December of 2019, requested information about student enrollment that was entirely appropriate in order to understand the operations of the school. Where to this date, that information has not yet been provided. And as the agenda also details, staff were thwarted in their attempt even to conduct the audit in January, which I would add again is something that in my 13 years in the job has never happened. I'd be happy to answer questions if council members have it, but as I said, I'm reluctant to belabor the presentation too much. That's the gist, and staff would request that council approve the resolution that appears on page 76 in the agenda book. Thank you, Mr. Ampe.
Any discussion?
If you need a second, I'm the second, I believe, on the motion.
Well, who made the motion? Tom?
I'm about to make it.
Ken, you made it. Okay.
I'm about to make it now. I make a motion that Chev instructs staff to initiate processes to revoke Medical Learning Center's certificate to operate in accordance with the requirements of the Administrative Process Act.
Okay, Mary, and you second it. Okay. Joe, at some point, my understanding is this is just the beginning of the process. And at some point, the institution will have ample opportunity to defend their actions and to make their case for remaining approved. Am I correct?
That is correct.
Okay, so we're just, if we pass this motion today, all we're doing is starting the process. We're not revoking their status, and they will have ample opportunity to defend themselves.
Yes.
Any further discussion? Okay, Lynn, please call roll.
Mr. Ampe.
Aye.
Dr. Atkins. Ms. Connolly.
Aye.
Ms. Harker. Mr. Fralin.
Aye.
Mr. Holloman.
Aye.
Mr. Light.
Aye.
Dr. Murray. Dr. Murray.
Aye.
Ms. Radcliffe.
Aye.
Dr. Ramsey.
Yes.
Mr. Slater.
Aye.
Ms. Webb.
Aye.
The vote is 10-0.
Okay, the motion carries. The next item on the agenda is a briefing on graduate out. No, I'm sorry, I've skipped Tom. Action on the draft establishing a process of developing a research and development inventory by Tom.
Mr. Chairman, this item is in pages 95, 96 of your board book for everyone's reference. And I'll give a brief introduction to this process, and then Emily Salmon, who led the effort on behalf of Chev, will fill in the details. But I attended two meetings that Emily hosted at the Chev headquarters of the groups that she surveyed for this effort. This was an effort that was put to in our, you might say, collective lap by the legislature to help VRIC in its efforts to increase the research and development efforts in the Commonwealth, and of course is very much in line with our goals and objectives of increasing the welfare and the development of business in the Commonwealth of Virginia. But it was a daunting task, and some of the conversations that were held were very impressive, as the earlier presentation we had from Dr. Cassell from UVA reflected this morning. There's a wealth of good work being done in the Commonwealth of Virginia, but there's not a good inventory of that work, and that's what Emily has put together a report on. Everyone should have received a report on Chev's research and development inventory effort. It's dated May 2020. And I'm now going to turn this over to Emily, and then if you'll kick it back to me, I'll make the motion or to approve the resolution that's on page 96 of your board book to forward this report. And of course, this whole effort now has been kicked over to the Secretary of Commerce for continuation, and has now been lifted from Chev's, you might say, bosom to another branch of our government. Emily, are you available to kind of fill in the gaps?
Absolutely. Can everyone hear me?
Yes.
And hopefully you see my screen. I want to carry on and thank you, Mr. Slater, for that introduction. Want to provide some key findings and recommendations that are a result of the report on establishing a research and development inventory. Want to provide a little bit more context in addition to what Mr. Slater shared, and summarize some of the common themes from stakeholder input that shaped the recommendations, and ultimately the advisory committee that was established as part of this effort to summarize their recommendations and looking specifically for input from council on these recommendations this morning. Want to first really level set and explain what constitutes a research and development inventory and why it's important. R&D inventory is essentially a state level research and development mechanism to catalog a state's research strengths and corresponding assets. Right now, as was mentioned by Mr. Slater previously, there's no one central repository of objective catalog of the Commonwealth's research and commercialization strengths and corresponding assets. In particular, to set the context of COVID-19, it's particularly important to answer questions such as if a government official is looking to identify experts in infectious diseases or immunotherapy, they would most likely get on Google, do a search that would lead to multiple sources, websites of institutions of higher education, private sector, federal labs within the Commonwealth, to then identify, and these would have different amounts of information. So really, to be able to pull this all together to showcase Virginia's strengths in research, and also to be able to objectively identify assets, whether they be equipment or expertise in faculty and researchers. Additionally, this effort really builds on work previously done through Chev's statutory responsibility to develop the Commonwealth Research and Technology Strategic Roadmap, which was an effort that was completed in the latter part of last year, ultimately approved by Governor Northam in November. The intent of the roadmap is to identify research areas worthy of focus within the Commonwealth and to create a framework for collaboration between higher ed, industry, and economic development. Some of the information and input gleaned through that process identified options for what a research and development inventory could look like, but did not formally establish a process for doing so. The intent has always been, once the roadmap was approved by the governor, to then pivot and establish the process as fulfilling a statutory requirement of the roadmap to basically determine how this inventory could be maintained within the Commonwealth. That information was presented to the Virginia Research Investment Committee in December for them to weigh in. Additionally, there was presence by those involved in the new Virginia Innovation Partnership Authority. They conveyed the need and support for such an inventory effort and charged Chev with obtaining additional focused stakeholder input on what that should look like, and to present recommendations by June on the findings and prepare a report. And so that is thus the timeline in presenting today to get input on this draft report. The process for this R&D inventory effort very much was modeled after the process for the strategic roadmap that Chev developed. It was focusing on input from a variety of stakeholders representing higher education, federal research, economic development, private sector interests, and research activities. There was additional input from regional technology councils sought, And it really covered the gamut from tech transfer experts to chief research officers to CEOs of companies to weigh in on what the needs would be for a research and development inventory, how it would be used, what types of information it should include, and the level of detail. Additionally, just as was done for the roadmap and the expert panel that Mr. Slater was able to join in all those meetings last year, formed a inventory advisory committee of a cross-section of individuals that represented these diverse stakeholder interests and also had familiarity with research and development inventory concepts. And those 7 members then took the input and the common themes from those individual interviews with the stakeholders and made recommendations that will be presented today to you. And that was really their charge. I did want to point out that the Center for Innovative Technology that will be transitioning to the new Virginia Innovation Partnership Authority did have representation as part of this overall process. Wanted to spend a few minutes highlighting some of the common themes from stakeholder input, and they really focused on internal and external uses for a research and development inventory. From an external use, you can imagine, as in other states that have a statewide inventory efforts that have a publicly facing website component. In this case, stakeholders really felt the need to quickly identify points of contact, whether it be for available equipment at a higher education institution, for example, use of a mass spectrometer by private companies that's available at, say, a given university, to identifying expertise within Virginia on a particular subject matter research, and all of those wraparound programmatic resources that they bring to bear, such as their research team, their corresponding assets, whether it's a research center affiliated institute, grant funding, intellectual property, commercialization activities, etc. And from an internal use perspective, stakeholders really felt there would be an important and value in being able to benchmark themselves from an institutional perspective amongst and against their sister institutions in Virginia, and as well at a statewide level for objective assessment of activity in research and development, and also to identify opportunities for collaboration. Consistent input regarding the scope of some sort of inventory platform was that it should be more broad than deep, that there should be a lot of high-level information and various data points versus every single journal publication, peer review, citation, etc., that any faculty member or researcher had ever been involved in, but really more of a high-level view of activity on a particular area of focus. From a scale perspective, there was a lot of input on keeping a taxonomy structure, potentially looking at the roadmap 6 areas of focus that were identified through that process as kind of the overarching organization for such an inventory to be able to drill down further and potentially get broader within those areas as a second phase. One item that is very important and cannot be overlooked is the return on investment, and being able to demonstrate use and impact for such an inventory is paramount to its success. It has been the challenge for other states that have led these efforts to be able, those that have survived have been able to effectively demonstrate use and impact from this inventory tools that they have, and should be something that is built into this process from the onset. The advisory committee met in early March to weigh in on the common themes just shared with you this morning, and their recommendations boiled down simply into 3 recommendations. First, that this inventory should serve multiple uses in addition to fulfilling the statutory requirement of the roadmap, which is to attract research and commercialization excellence through the inventory, and that those uses should address users in economic development, industry, and higher education. That there would likely need to be different publicly facing components to this inventory platform and internally facing components in order to satisfy the needs of these various users. And in order to speak to and address return on investment, the committee felt that to prove value early on, they should start with a pilot project, scaling the inventory from one particular area of focus in the roadmap. For example, taking cybersecurity and having that be a limited scope pilot of an R&D inventory to fine tune, make any adjustments, and then scale up to other areas of focus to make sure things get done right the first time. And so that was the third and final overarching recommendation. So with that, really looking for council to weigh in on the recommendations and information provided in the draft report. We'll look to incorporate that input and present that to VREC for action in June, and we'll also be recirculating around to the Inventory Advisory Committee for additional input on the draft, and we'll convey to those parties specified under statute for the roadmap for the final report, and we'll also ensure that CIT, the Center for Innovative Technology, receives that as well, since they will be the ones transitioning the commercialization and research activities under this new entity, VIPA, in July. So any questions?
If I could ask a question, Tom?
Yeah,
Yes,
Mark?
of course.
Thank you. So Emily, when you look at what all will be required to get this work done, what do you view as kind of the most likely, what's going to be the most difficult in actually accomplishing what you've described here?
I think once, the lead, whoever is leading this, assuming that it would be the entity in transition here, it would be assessing the scope and getting an idea of this, if this is something to be done internally. Some states and even higher education institutional systems lead this effort, and sometimes they source it to outside vendors. So I think that's really the first and most critical decision. And then from there, that really, there's a domino effect of then what needs to take place from an internal perspective, or if it's something that's perhaps more candidates vendor based. I think that's really the most important first step.
Okay, very good, thanks.
Are there any other questions? Tom, I think you and Henry attended a number of the meetings of the VREC Council when all of this was being discussed, and I think that there was a significant amount of concern that with the limited dollars that the Commonwealth had to focus on this area, that maybe there was an inefficient use of those dollars, and that they were trying to fund some minor amounts of research, minor in terms of the dollars that research dollars that are being expended for research nationwide, and that the dollars really were not enough to move the research needle in terms of what research was taking place in the Commonwealth, and that they might be better spent on helping these startup companies and identifying areas where the startup companies could make a greater impact in the Commonwealth. And I think that there was a feeling that maybe a lot of the people that were most knowledgeable about startup companies and had been involved in startup companies were not at the table, and that this new effort would better coordinate the research component in the Commonwealth and better coordinate the commercialization of what research is coming out of Commonwealth. We have a lot of research in the Commonwealth, a lot of quality research, but very little commercialization. So there obviously was a disconnect. I don't know if Henry or Tom want to comment on their observations when they attended these meetings, but that's what I think is the real bottom line here.
Well, this is Tom, Mr. Chairman, and I couldn't agree with your summary, and you did a very good job of summing up, since you served on the VREC committee, of summing up my takeaway from those meetings. And I would just say it was clear that Virginia is really playing catch-up ball to other states like Georgia and Massachusetts and of course California on this whole effort. But I really think we've gotten, the attention of all the right parties. And as you put it very well, we need to make sure everyone is at the table, and these startup companies need to be there. And so I hope with the movement of this effort into Brian Ball's arena and the Secretary of Commerce, that the right parties will be at the table and will be moving this effort forward in a very effective and hopefully efficient way. And I think the great work that Emily did over the last year, which, as I said at the beginning, is really, in my judgment, a Herculean effort trying to pull all this together. And now the creation of the roadmap, I think, was just outstanding, and with not a lot of resources to do it. So we owe her a real pat on the back for her good work and tremendous work on this.
Okay.
Hey, Haywood?
Yeah, Henry. Huh?
Yeah, let me toss in my 2 cents worth. I think Emily's done a great job on all of this too, and it's a very complicated business for a state to, like we have said Virginia should, to advance itself in the research arena. Virginia is trying to do that, and I agree with you, with not enough money, but I think we need to sort of develop it in a way in which the General Assembly gets more confidence in the way to spend money on research. The issue I see is that Chev has said that we want to see Virginia advance in the standing of states in educational research. That's part of our strategic plan. And if you continually look backwards at what you've already done, which we've been inclined to do, and I expect it's easier to do it that way, you don't really look forward at what might be opportunities in the future. This presentation we had on this morning sort of talks about what the future looks like. It doesn't talk about the past. It talks about the future. And so somehow our research focus needs to be not just on the past, and I think the past is important, but also in the future. And I haven't seen much of that in the discussions, either at VRIC or at the state level. I don't know how we get it there. I think we have to get it there if we want to make significant improvements in Virginia's standing among the states and overall university research. But I'm not exactly sure how to get there. But I think we should recognize as a body, Chev should, that this is a work in progress, and we're still working our way toward where we want to be. And it's still not clear exactly how you get there. Thanks.
Okay, any other comments or questions? Okay, hearing none, do we have a motion to approve the report?
Yes, Mr. Chairman, this is Tom Slater speaking. I move that the resolution that's on page 96 of your board book, that we find the draft report on establishing a research and development inventory to provide a clear process for creating a catalog of R&D assets within the Commonwealth in compliance with statutory requirements, and that we approve the draft report that has just been discussed and outlined by Ms. Salmon. And that report, of course, is a report on establishing a research and development inventory. And if there are any revisions offered by council, I would encourage those to be offered now. If not, I would ask for the approval of this resolution.
And I second that.
Okay, we have a motion by Tom and a second by Henry. And any further discussion before we take a roll call vote? Okay, Leanne?
Mr. Ampe?
Aye.
Dr. Atkins? Ms. Connolly?
Aye.
Ms. Harker? Mr. Fralin?
Aye.
Mr. Holloman?
Aye.
Mr. Light?
Yes.
Dr. Murray? Dr. Murray?
Aye.
Ms. Radcliffe?
Aye.
Dr. Ramsey?
Yes.
Mr. Slater,
Yes.
Ms. Webb.
Yes.
Ayes 10, no 0.
Okay, the motion carries.
Mr. Chairman, this is Peter.
Yeah.
Real quickly, before you go on, I also want to commend Emily. This would have been difficult work in any times, but particularly in the COVID era. She did an excellent job, and this will be a high quality product that we can hand off to the new Innovative Partnership Authority, and ideally they will take it to the next level as council members have discussed. Grateful, Mr. Fralin, for your work on the VRIC, the Research Investment Committee, as well as having Mr. Light and Mr. Slater so intimately involved in these issues. I did want to just end with a highlight here. I noticed that last night the federal government signed a $354 million 4-year contract with a pharmaceutical company called Flow Corporation, which happens to be in Richmond, Virginia, and is led by one of the advisors that Emily had on her advisory committee, Dr. Edwards, and also is led by a faculty member at Virginia Commonwealth University. So we're seeing a translation of some of the research work that's going on in our university, some of the advisors that we've had over the last year or so, really breaking through in a material way as Flow will be producing the medications that can help treat COVID-19. And so I just want to call attention to that and end this discussion on a really high note.
Thank you, Peter. All right, the next item on the agenda is a break. I find it very difficult to take breaks on Zoom meetings. And so what I would encourage is anybody that needs to take a break, take one, just get up and take it, and we'll continue if it's okay with everyone else, and complete our agenda. So next item on the agenda is Joe DeFlippo, who's going to introduce Jim Ellis, who has been very much involved in our graduate outcomes survey. So, Joe?
Yes, thank you, Mr. Chair. I won't belabor the introductions of Jim Ellis. He's familiar to council from his many prior presentations about the work of the survey, and he's going to give you another one today. And this one will have some interesting tidbits thus far about the conduct of the pilot, which however is still incomplete, but we're starting to get some real information here. And I'll turn it over to Jim.
Thank you, Joe. Good morning, everyone, Mr. Chairman and Director Blake, and everyone listening in or watching in. I'm going to share my screen. And I'm going to start the presentation. And can you see that opening slide now?
Jim, go ahead.
Yeah, okay, good. So as Joe mentioned, yeah, this is not the first time you've heard about this. I'll try to get through some of the earlier slides quickly, and they'll be on the record for you. The project plan in various phases is before you here. We've had to stretch it out for a couple of reasons along the way. COVID-19 has again affected us on our timeline, but we are in the last stages of data collection for the pilot survey. It will be pretty ambitious, to say the least, to try to finish on the timeline we have under contract right now, but we're really pleased to be where we are with the pilot survey, especially under the circumstances. Along the way, we've had to make some adjustments to our study procedures due to COVID-19. We were restricted in what we could do in our home-based work to process the mailing. Our print vendor stepped in and basically became our mailing crew for the last couple of mailings that we had to do, and is also serving as our courier. So we're very grateful to their adjustments there. We have been prohibited from fulfilling target gift cards by mail. Gift cards were promised to some of the respondents. So we've had to do additional changes to our wording to let them know that they're going to be delayed. But we've gotten through all of that. We did get our first administrative data set from SHEV. So recall that the study is interesting not only for the survey itself, but because we're asking survey participants if they would allow us to link their survey responses to the administrative data available from SHEV. So we're working through some of those linkages, and you see some of the other administrative things that we've been doing to help us deliver the summary of the pilot survey activities before the end of June, and then to get ready for the larger scale production survey there. So just some detail here on what we've done with the pilot survey. If you were unlucky enough to have both a mailing address and an email address on file with us, you got up to 9 contacts from us to encourage you to do the survey. We didn't really have complaints from people about numerous contacts. And if you only had a mailing address for us, you got 4 contacts, all by mail, of course. So our data collection period has stretched out to about 76 days. That's longer than we would have liked, but those delays were due to COVID-19 impacting us in the middle. We will probably close data collection on May 22nd, but we're still getting paper questionnaires coming in, and so we'll see how those play out this week before we make a final call there. This is what it looks like just for raw number of responses by date. And you can see that, and I don't know if you can see my cursor on screen, you probably can, but you can see that basically every time we reach out to people with a contact method, we get a bump in response. There's a long valley here where the mailing of our paper questionnaire stretched out about 3 weeks longer than we would have planned. But once we get those paper questionnaires in the mail, you start to see pickups. And most of these responses coming in right after the mailing goes out and arrives at people's homes, those are responses coming to us on the web. It's not until May 7th, somewhere around in here, and then in these couple of days that we start seeing the paper questionnaires actually arriving back to us in the mail. So one nice thing we've seen throughout this survey is that the paper and the electronic methods are reinforcing each other. We send out paper, we get bumps through electronic responses. We send out electronic reminders, we get bumps. And it's nice to see that those are reinforcing. So some key metrics that we've been following all along. Looking at survey starts, and we're only looking at this on the web. First of all, most of the responses we have so far are by web, but also we don't know how many people sat at home, started the paper questionnaire, and then quit. So we're just looking at survey starts web only here. About 28% of our total sample of 3,648 started the survey on the web. And you may recall that we went into this pilot with a pretty long survey, and there was some concern about whether the survey was too long, whether it would be discouraging for people to do, whether they would quit in the middle of it. And we're really pleased to see that 88% of the people who start the survey are completing the survey on the web. So that's really great, especially considering that the median length of time to complete the survey is about 30 minutes. I mentioned earlier the link to the secondary data. Just about 2/3 of the survey respondents are agreeing to link to the secondary data, which is pretty good. It's a little bit below, I think, what we hoped for, but it's not bad. And here so far, the breakdown of how people are responding to the survey. Most of them are using the information we sent on paper to either type in a URL and get to the survey online. That's the anonymous link with the login code. Some of them are using the text back code that we put on the letters to get the survey URL on their phones. Some of them are responding to a personalized email. And that 16% may seem a bit low, but it only applies to about 60% of the sample because those are the only ones who had email addresses. So the percentage is a little bit better when you base it on only the eligible ones who could have responded to a personalized email. We are getting people using the QR code that was also printed on the letters. And again, the paper so far, 7% of the completions on paper, but this is very early. We're not really sure how many we'll get yet, but we have 72 so far. So overall, the response rate is 27%. That's a response rate that's blended across, you may recall, lots of different combinations of experimental treatments that we put into this pilot. The purpose of all these experiments was to inform our thinking about what costs would be for the production survey, what response rates might be, and could we model a good production survey, what's the best bang for the buck in essence. We've looked at these impacts of these methods experiments several different ways. Overall, in modeling, these manipulations explain about 30% of the variation in response rates across all the different combinations of treatments that we had. The ones that have the most effect, not surprisingly, are the amount of the gift card that we offer, and then to some degree, the type of envelope that we use, and also whether we send letter reminders or postcard reminders. The other ones have small impacts, but not significant ones. So if you look at this in aggregate, if you create sort of a treatment scale and you give points for each one of these 6 manipulations that we did, from the minimum manipulation being 1 point each up to the maximum 4 points for the top gift card of $20, 2 points if you give $2 instead of $1 and so forth, you end up with a treatment scale that ranges from 6 to 14. And the basic point of this complicated slide, each dot representing an individual combination of those 6 treatments. There are 160 different combinations of those treatments throughout our sample. But the basic point here is the more you offer people, the nicer you try to be to people, the higher the response rate. Our question coming out of the pilot is going to be, again, what's the most effective, cost-effective, best bang for the buck approach combination of these different treatments that we tested in the pilot. So we're pretty pleased with some of the early indications from the pilot survey. People will do the survey and they're taking it seriously. The responses we're getting are mostly serious and genuine. Very, very few cases where we're having to throw them out of the data set because you can tell by the responses that they just didn't take the task seriously. And this is all despite the length of the survey. The lists for mailing addresses and emails are pretty clean. The questionnaire is functioning pretty well. There are a couple of very minor things that we would tweak for a production survey. People are using the QR code on the letter. We designed sort of what we call a special seal envelope. It's a business style envelope, but it treats the graphics on the envelope differently from the standard Chev envelope. And that gets a better response rate. It adds a few percentage points to the response rate. It's really no additional cost to print those envelopes versus the standard envelopes. We tried an invitation style mailer, which was supposed to look more like an invitation to a wedding or a card or something. And it had no effect. We were surprised by that, but that's fine. We learned about it in the pilot at small scale. We are seeing increasing mentions from people that they are not working due to COVID-19 layoffs, and we may need to take COVID-19 impacts into account when we think about the content of the production survey. That may require a little addition here or there or change in content. And we know, looking at the restrictions that we've had placed on us during this lockdown period, we would need to go back to the Wilder School or VCU and talk about how we could really handle a mailing at scale and get some of those restrictions loosened up a little bit, I think. So coming up, we are delivering a summary report from the pilot before the end of the year. We will be looking at some of these key variables. We've worked through some of the data linkage so far and put that in front of our colleagues at VCU who are doing some of the employment outcome modeling using that data. We got to complete those linkages for them. We're coding open ends right now, and we'll complete that coding, and we'll get some cost modeling together, and then we can start talking about the sample design for the production survey and getting that production survey done. So that's what I have for you today, and I'm happy to answer any questions or have follow-up discussion.
Do we have any questions? Jim, can you hear me?
Yes.
I have a question. How concerned are you about the COVID-19 virus skewing your results?
You know, there's been discussion about the virus helping survey response rates. So that's one question that's come up in our discussions. We had what I thought was better response than I anticipated in the week that we were in the field before the lockdowns came. So in terms of response rate, I think there's no doubt that we're probably being helped a little bit by the virus, keeping people at home. But I think that it's still a pretty solid look that we're going to get a decent response rate even on such a long survey. Now, more importantly, perhaps to content, you know, I don't know. You know, a chunk of the survey has to do with employment, current employment and so forth. And so we have people who are essentially not going through those questions because they're currently laid off. One of the interesting things about running a survey through a period like this is you do start to see the impacts in your data and in the comments that people are giving you about this breaking situation. I don't know. I don't know how the survey would work in a world where we were still seriously locked down for several more months. Certainly, functionally, there would be ways that you could get the survey done, and there would be modifications that one could possibly make. But the mail method of communication is really important in this survey. So we'd still want to do large-scale mailings. People seem to be opening the mail. They seem to be responding to the mail. How the content would change, I don't know. A lot of the survey content is retrospective, people talking about prior experiences during the undergrad education that got them into the survey to begin with. But the information about current employment is going to be skewed by these layoffs.
Is there a way to isolate the responses you had prior to the outbreak of the COVID-19 virus?
Yes, and certainly for the electronic method, we know the precise date and time that each response was registered in the system. For the mailings, we know what date that we're logging them as having been received. So we have excellent time frame on the electronic responses, and we have pretty decent time frame on the paper responses.
Well, we may be able to have a footnote then that would describe the results as of the outbreak of the virus, and show how it was different then than it is subsequent to the outbreak.
Right, and one of the things that I've thought with regard to the pilot is that because it is a pilot and focused a lot on nuts and bolts, the actual data may not be quite as critical. The representativeness of the data to the so-called normal situation may not be quite as critical as it would be if this were the full production survey. But yes, we could look at changes in chunks of responses based on certain key dates. We could look at change over time to a certain degree, much of what we're going to say in the summary report on the pilot, I think will focus on methods and logistics, and less so on trying to use the pilot data to characterize the population at this time. Does that make sense?
It does. Any other questions of Jim? Thank you, Jim. We all look forward to the final results of the surveys.
Thank you. Appreciate it.
Okay, next item on the agenda is Todd Massa, and he's going to talk about 2019 fall enrollments, which could be quite different from 2020.
Good morning, Mr. Chairman. Thank you. I do have a very brief report, as you see in the agenda book. There seems to be not a lot of point to me to talk about fall 2019, since it may be completely unrelated to what we see in fall 2020. There's a lot of change in the air. We do know that last fall, the public two-year institutions did suffer declines in enrollment. Only 4 colleges had increases from the previous year. And for the private colleges, even though they had a net increase, most of that was simply due to Liberty and covering most of the loss, all the losses at the other institutions. It's a challenge really to say much about what's going on with enrollment, so I don't want to. I'll take whatever questions you have. But what we do know is what I mentioned in April. FAFSA completions are down from our early, and this is a precursor for next year, particularly with recent high school graduates or soon to be graduates. From our own early enrollment estimates for the spring, which are a new feature we added last year, we're down just about 1% overall, just from the fall. So decreases seem pretty clearly to be in the air. And with that, Mr. Chairman, since I have no good news, I'll stand by for any questions people might have.
Yeah, Todd, I'll ask a question and then open it up to everybody. How many foreign students did we have in the fall? Do you know?
I do not know offhand, but I can tell you very quickly. And are you thinking publicly or private or overall?
Well, overall, but both. If you could break it down, public, private, and then overall, because I think there is a significant concern about any of the foreign students, or certainly a significant number, not being able to travel.
Correct. I think there's little doubt those numbers will be down. And one moment.
And furthermore, all of the foreign students were paying the higher tuition, which the reduction of those numbers significantly affects the financial outlook at every institution.
Yes, sir. Mr. Chairman, we had roughly 20,000 international students in the fall. 3,000 at the independent colleges and 17,000 at the publics.
Boy, that's a huge number.
Of that 17,000, 14,000 were at the public 4 years.
Henry?
Yeah, thanks. Todd, we've talked in the past about the community colleges, and do you expect a bump? And I know we usually see community college enrollment go down during economic good times and up during economic bad times. now we have economic bad times along with a pandemic and people locked away from school. How do you think this is going to impact the community colleges?
My challenge in trying to think about next fall is, one, let's accept the logic of the past. The relationship between employment and community college enrollment is pretty strong. There's a strong correlation there. So I will not be surprised if there is at least a maintenance of current enrollment as opposed to a decrease or an increase in enrollment at the community colleges. But I also have a challenge with all the predictions of doom and gloom, in that I have a hard time imagining nationwide a significant portion of 14 million students staying home and not working. What are people really going to be doing in the fall? What are young people going to be doing? Do they really want to sit at home and do nothing? There may not be jobs available. So I think a lot of the problem with predicting what will happen is the inability of institutions to know whether or not they will be fully open yet. Once those decisions are more in the public and better known, and people start establishing comfort, then I think we'll have a better sense of what's going to happen. But I could make predictions on both increase and decrease and feel good about them.
Mr. Chairman, if I could ask a question?
Yeah, Marge.
Todd, have you thought about what other data we could be, that we don't traditionally collect, but that we possibly could be collecting on, a weekly basis from institutions that might provide us with some additional insight? I'm thinking of things like, how many deferrals have the schools granted, and how does that compare to a typical year? Or, I don't know when deposits are due. I really wish we could get a little, I understand it is like such a crazy moving target. And a lot of, schools have extended their deadlines. Students are choosing to not make a choice until they know for sure, right, if somebody's opening in person or not. So I absolutely get that anything we do is going to be quite imprecise. But is there anything more we can start to gather that might help?
Mr. Chairman, I proposed a possibly weekly collection to the institutions last fall for just this kind of information, really on the entire application process. And it was really not well received. There are certainly things we can do, but I do try to balance burden with value. And if there is a consensus that we should do this, we can certainly revisit the discussion with the institutions. It will hinge upon what promise of value we can give them for the additional workload. Because things do change dramatically with individual students. And when you're looking at tens of thousands of the records that are exchanged and the decisions are made on a weekly basis, I can understand why the institutions might feel overwhelmed with such a collection, even though we did try to design it as something very low impact.
Haywood, this is Carlisle. Could I follow up on Marge's comments? I know it's very difficult. It was based on what Todd just said, to get information, you know, of this nature. And with the, you know, challenges we have with social distancing, et cetera, et cetera. But there, you know, social media is still going very well. And in terms of people communicating with their devices and so on. And I wonder if there could be some way, and I'm not suggesting that Todd needs to take this on as a special project, but for example, we're going through a different variety of high school graduations now, you know, drive through, whatever, you know, and it's, so that's just something to think about. And is there a way through social media to connect with some of these students, particularly those who might belong to some organized group, to just get some immediate feedback on, hey, what are your plans, you know, for the fall? These are high school seniors now, and have your plans changed? Those kind of, and I was thinking when you were talking about the community colleges, you know, there are some organizations that have pretty good connections. I'll give you two. The Community College Honor Society, Phi Theta Kappa, those people stay together in a way. And also the counterpart is the technical vocational students. And you might get a small sampling. No, you might not, whatever that would be, but it might give us some information, some perspective on just what students, young, you know, whether they be 17 years old or 47, what are they thinking about in terms of their plans? And it may be too much, particularly at this juncture, but it might what students, unemployed people who, you know, who may not be able to go back, and what are they, you know, what kinds of challenges are they? And this would be a kind of electronic focus group approach, because it's going to be exceedingly difficult to get people together. But social media is going very well. And young people use it all the time. I mean, that could be the most important form of communication.
Yeah, I'm sorry, I interrupt you. Go ahead, Carl.
No, just you know, rather than a recommendation, just a thought.
Well, we clearly need the information. We don't know the extent of the problem right now, because we have no idea how many people are going to enroll in our colleges and universities and community colleges. In fact, we don't even know if they're going to be open.
Yeah.
And if so, when. So until we can find out where we are as institutions and as a system, it's going to be very difficult to determine how individuals are reacting to that. So, Marge, I don't know what your plans are for the upcoming year, but it seems to me that we have a lot of unknowns that we're going to have to figure out some answers to.
Yeah, I would just say, you know, Todd, if there are, I think the FAFSA, how frequently do we get FAFSA data?
I can get the current FAFSA completion data for 17 to 19-year-olds from Virginia basically daily.
Basically daily?
I try to do it weekly or every 2 weeks.
I do think that, you know, is definitely a leading indicator, and that one is maybe a little bit, you know, still doesn't mean people are going to actually follow through, right? They can be doing that preemptively. But I guess I would just encourage you to put down on paper, what could be some of these leading indicators, some of which may be, hard data, some of which may be soft data. And obviously, clock's really ticking for this first enrollment conundrum. I don't think it'll be the last one, coming out of this. So I would just say, if we can, I get the uncertainty. Interpreting it is going to be imprecise, incredibly imprecise. But I still think it might be helpful. So if you can figure out something that's not burdensome, that you think would have some directional value, I would say it's worth taking a peek at.
I'm certainly interested in doing that. And to Dr. Ramsey's point, one thing that is possible, but we should have some discussions about this, particularly in terms of its appropriateness and privacy concerns. We can scan electronically social media on a regular basis, Twitter, Facebook, for people we know to be students in Virginia, and to find out what they're saying publicly in those venues. Now, I have hesitations around the privacy aspect of government doing that, but it could be the type of leading indicators that we really need on a regular basis.
Mr. Chairman.
Yes, Katie.
I have a question that I think is directed to Peter, but it's with regard to the group appointed by the governor to talk about reopening both K through 12 and higher education. Do you envision the work of that group to include guidance to the publics as to how they might open? I mean, is that part of the charge that they'll be addressing? And I guess I'm trying to figure out whether they're going to go their own way and do their own thing, or are they going to look to the state to help them set the parameters of how they might open or not open?
Yeah, Mr. Chairman, Ms. Webb, that's an excellent question, and determining exactly what kind of guidance that group will give is something that we have to determine. And I know Mary Ann Radcliffe also will be working alongside me on this. You heard some of the conversation yesterday about the uncertainty, and I'm sure the colleges, universities would like to have as much flexibility in opening, but they also know that there are going to be some state requirements and guidelines around social distancing and density and testing and contact tracing and cleanliness of facilities, all those sorts of things. And so as they are developing their own plans, they want to make sure that whatever they develop are in some kind of rough conformance with what the state's going to be requiring, or else they could do all these plans and then on a certain date realize that they're out of compliance. And they certainly don't want to be in that situation. So it's finding finding the sweet spot in giving guidance that is, covers the public health and academic concerns, but also allows a little bit of flexibility for the institutions where, a VMI is different from a Northern Virginia community college. So it's that kind of guidance. I don't know, Ms. Radcliffe, if you have any other ideas on this.
No, I think at the risk of being repetitive, I would say, we have a long way to go and a short time to get there. But, my thought process, and there's a lot more discussion that needs to occur, and certainly people who are actually on the ground and have to implement this are probably the most important voices to listen to, is it's sort of a set of guidelines and methodologies rather than something that's going to be a one-size-fits-all approach, which Peter has more or less referenced. And I think there'll probably be minimums, and some schools are going to need to do more than others, just based on any number of situations, the more porous campuses, where they're located, what they've seen in their testing. But, I think there'll be conversations about things like gating criteria, and obviously we're all concerned about the student health and safety, but there's also faculty and staff and the communities they're located in. So it's broad. But the good news is Fran Bradford, I think, has been working hard on that, and Peter, obviously, everybody's in close touch, but yeah, I mean, that's certainly a part of it. Yes, I guess is the very long way of saying, yeah, Katie, I think that's going to be probably the most important thing that happens on that particular group from a higher ed perspective.
Thank you. That was my point, because we can talk about what we might learn from the students and when they declare they're going to enroll, but those parents and the students also need the guidance from the state. They're looking for answers to their questions. So.
Yeah, and I think it's probably important to say that, parents of first-year students and first-year students themselves probably have a different level of anxiety, certainly understandably so, than returning students who are sort of aware of the atmosphere in a way that's just different. I think they're going to need more reassurance than returning sophomores, juniors, and seniors would be my guess. That's just completely anecdotal, but I certainly think that that's probably the case.
Thank you.
Todd, do you think that dialogue with your colleagues in other parts of the country might be helpful, because you may get some innovative ideas and some discussions that may be helpful in hearing what they're experiencing in terms of incoming classes and incoming students and the makeup of those students that might be helpful in your determinations?
There's no reason not to pursue those. I have a lot of really great colleagues that, are doing some outstanding work across the country and who are always willing to share. So I can certainly reach out to them and see what they're learning.
Okay, any
Hey,
other?
Yeah, this is Carlisle. One more observation. We know what's going on now. So many hundreds of thousands of students are now taking online classes or finishing them, whether it be high school or middle or whatever, and obviously college, university. You'd have to, is the expert on the sample and the data, but there is a way to get some data, some feedback from students immediately, and that is working through the universities and the colleges and the schools with faculty who are now teaching online, and they, I know they always ask the students to evaluate the class, and it's the part of the effectiveness process, and having a sort of a very brief survey about not only had their perception of that particular class, but also what are they concerned about in terms of continuing their education, in the immediate future, and what do they feel safe, going back to the campuses? I mean, this is pretty elementary stuff, and I think the higher ed community, as well as PK-12, could generate some interesting data. It may not be, it may not be quite as valid as we would like for it to, but there is a way to get feedback from students now, and that's online learning classes.
Okay, any other comments, questions? If not, we'll move along on the agenda, and Wendy, briefing on the launch of Chev Insights.
Thank you, Mr. Chair. Actually, Tom Allison will be providing the main part of this briefing, but we're really excited to launch this additional communication tool into the variety of tools that we have in our toolbox. So I will leave it to Tom to try to give you a little more of a background and intro on this new project we have.
Thank you, Wendy. Good morning, Mr. Chairman, members of the council. I'm excited to join you this morning to discuss a new platform that we're calling Insights. to better communicate higher education topics and analysis, all in the interest of advancing Chev's broader mission to improve higher education in the Commonwealth. So as you're all aware, and as we actually heard from Mr. Massa in the previous presentation, Virginia is a national leader in data collection and dissemination. We host a lot of information on the Higher Ed Data for Virginia website, hundreds of customizable reports aggregating a decade of Chev's student-level data collection. And we also develop other analyses and resources, such as the Strategic Plan for Higher Education in Virginia, really just a wealth of information and analysis and resources on our website. But we believe that a consensus has emerged, however, that we need to do a better job of drawing attention to these resources, ensuring they're effectively informing decision-making, and then broadly telling the story of higher education in Virginia. So as a specific example of this consensus, in 2019, the Council's Ad Hoc Committee for Data and Policy undertook an extensive review of Chev's current reports available on the Chev website, and identified the need to improve communication and awareness of Chev data resources. So responding to the committee's recommendations, Chev has launched a new platform for analysis and communication of higher education topics called Insights. This new platform will be targeted to 3 primary audiences. Number 1 is policymakers, so legislators, Capitol Square staff, etc. Number 2 is institutional leadership and administration. And the third audience is regional and national media. We have 3 objectives with this platform. We want to, most importantly, guide or assist in the decision-making process. We want Chev's resources and analysis to improve decision-making and, again, broadly advance Chev's mission for higher education in the Commonwealth. Number 2, we do want to help create, change, or improve practices on campuses. So we're going to engage with institutional leadership and administration, and actually really hope to develop some recommendations that of ways to improve policies or practices. And then third, we really just want to build awareness of the resources and information that we have. So the first example of what an insight would look like is actually live on our site. And I'd be happy to share my screen so everyone can see it. I hope, am I sharing that right now? Can I get a nod?
You are.
Great. So you'll see on the main page under researches and publications, there's now a third button called Insights. And you can see our first post, which we're considering this sort of a soft launch. We haven't, we wanted to show it to council members this morning before pushing it out with a press release tomorrow, is a breakdown of the governor's budget that is expected to be signed this week, so relevant and timely, showing the $389 million in new funding that was unallotted in the governor's amendments, and includes a visualization that breaks down where those funds are going. So this is what the platform looks like. And we've had a lot of discussion about different topics that we'll cover. And we had a calendar developed of topics prior to COVID, but we really want to be sensitive to the state of higher ed and frankly be relevant to current decision making. So this first post was not the one we originally envisioned, but we hope it'll be useful in terms of showing where the $389 million in unallotted funds was going, and frankly to be a marker of what we think a good higher education budget looks like, one that advances equity, one that supports students, and is also aligned with demand in the workforce, various other topics that we've covered this morning and in the last year. So we have had to rethink about some of the specific topics And we've discussed already this meeting about the importance of understanding current student experiences. And to that end, we actually fielded a digital survey to current college students in Virginia. Certainly does not have the scientific rigor of the graduate outcome survey, but we were able to collect some perspectives from students in terms of how they're experiencing this pandemic, how their academics have been disrupted, their ability to meet basic needs, so their experience with housing security and food insecurity. So that is what we think would be an appropriate topic to explore throughout the summer. Again, just the student experience in dealing with COVID right now, and hopefully develop some solutions and recommendations both for policymakers and for institutions to help their students navigate this time. So I'd like to quickly go over some of our plans for distribution. So those are sort of our topics that are swirling around. We didn't have a shortage of ideas before, and we certainly don't have a shortage of topics now in this new reality. But in terms of distributions, again, we don't want these items to just sort of sit on our website. We plan on circulating each post to all institutions, Capitol Square policy staff, legislators, and members of the media. And I think each sort of push out plan is going to depend on each topic and each draft, but that's the general target and strategy. We'll definitely include them in our weekly newsletter. That list has about 1,000 subscribers and includes legislators and their staffs, institutional leadership, governor's staff, et cetera. So we hope to also build awareness through social media. We've covered a lot about the importance of social media in today's meeting. So we'll be pushing that out through our Twitter handles and other platforms. So I think also we know about the importance of, if not one-on-one meetings, but at least one-on-one reach outs. So we know that we want to make sure that specific influencers and decision makers have access to this information. I could talk a little bit more about the ways that we have incorporated the feedback from various stakeholders. I think we've presented our analysis of the CARES Act, for instance, both to the council here, but also our various advisory committees, showing how the $300 million in CARES Act funds gets distributed to Virginia institutions and collecting best practices for how to use those funds. A lot of our stakeholders are already aware of this work, and we've already conducted a lot of the work, but we hope that this will be a new platform to both visualize and push out some of the great work that our institutions are doing, and again, not have some of these resources lost on the website and have people unable to find them. So I think there's maybe one more example to sort of visualize how we're thinking about this initiative and this platform. There are some things that we're doing that we think can earn a lot of media and thus raise awareness. And a good example of that is our data match between student records and SNAP records is a first in the nation accomplishment, right? No other state can say how many college students are receiving SNAP benefits and how many might be eligible. Well, we've done that. And frankly, I think if we can find creative ways to elevate that resource and the tool that we have to analyze that information, and could generate national media interest, and of course regional and sort of trade media as well. And again, all in the purpose of improving practices on campus. I mean, that example might be one of, okay, well, how do we help students navigate the SNAP application process? Do we have a food pantry on campus? Is food security a serious issue on our campus? So that concludes my presentation. I think I did steam right through it, but I think that's a good way to do these presentations. And Again, really appreciate the time, and I'd be happy to answer any questions from council. Thank you, Mr. Chair.
Any questions? Yeah, Tom.
Yes, sir. Oh, yeah.
Can you hear? Tom, we're not hearing you.
Can you hear me now?
Yes.
Okay, I thank you, Tom, for your report and the work you're doing in this area. I just think, given what COVID-19 has done to our economy and to our employment figures, the things you list in your report on page 105, the topics of, you know, what jobs are available, what are the likely earnings and jobs, and what majors in each of our colleges and universities are getting employment. I can't think of anything being more important now, given the economic conditions, and letting students and parents know, you know, what the chances are of their getting a job once they finish a particular major. For example, does a philosophy major have as good a chance of getting a job in this environment as, say, someone with a degree in electrical engineering or computer science or other areas that seem to be more in demand? So I hope we can think hard about that and think of ways that we can provide that kind of information to incoming students as well as current students and their families, because you know, return on investment, it seems to me today, is more important than it's ever been.
Yes, sir. I think that list of topics was identified by the ad hoc committee on data and policy, and you're absolutely right. The topics were relevant then, and they're even more relevant now, but perhaps with a slightly different angle.
Other questions or comments? Okay. Next item on the agenda is for Katie and Marianne to introduce Emily to talk about briefing on our workforce alignment project.
Thank you, Mr. Chairman, and thank you, Emily, and thank you, Marianne. So I think the segue from Tom Allison's presentation on the data part of the new program Insights, I think, is a good introduction to the task that we were charged with. You all have had, the council itself has had lots of conversations about alignment of the educational programming offerings and workforce needs throughout the Commonwealth. And obviously, we have been turned on our head a bit with COVID-19 issues related to that. But we are very fortunate in having Emily, who has done yeoman service despite all of the challenges in kind of putting together, engaging with other stakeholders who care about this issue as passionately as the members of the council do. How do we achieve some sort of alignment between higher education offerings, program offerings, and the workforce needs of our business community? So I think that you're going to hear a report that has a lot of information, a lot of reaction of stakeholders to where we are today and where we need to get to. And we also, the good news is we at least were able to reflect some of the COVID-19 impacted higher education and educational offerings, so, or business needs. So with that, I'm going to turn it over to Emily, and unless Marianne, you want to add anything to that introduction.
All right. Well, thank you. Hopefully everyone can hear me and see this visual. And thank you, Ms. Webb, for the introduction. just to, again, reiterate, this project really charged with improving alignment between workforce needs and higher education academic programs that address occupational shortages as well as labor surpluses, and kind of a deeper phase of this really looking at skills and competencies. Want to focus very briefly on this visual that is in front of you this morning. As a result, it is a result of extensive input from various stakeholders, other states that have alignment processes in place from which the Commonwealth can learn, from input from higher education institutions in the Commonwealth, from state entities in the Commonwealth involved in economic development, higher education, and workforce development, as well as SHEV advisory groups and other national policy groups. This visual here represents really that improved balance, ideal alignment between higher education and workforce initiatives, programs, et cetera, and really represents it as an ecosystem. What this project and effort is not saying that these things are not underway within the Commonwealth currently. There is a lot of data out there. There is a lot of work around data. There is a lot of outreach to and partnerships with industry and other stakeholders, such as higher education. And there's obviously policy and various programmatic and other initiatives underway. This visual is saying that this is the common themes that were heard by these stakeholders in these conversations as qualities that are important and that need to be strengthened and coordinated within the Commonwealth. If you can imagine this visual in front of you right now, there in Virginia, where you have the solid blue, orange, and green, and instead imagine a bunch of blue dots, orange dots, and green dots in varying sizes that may or may not be touching each other, and that would represent Virginia. There's definitely pockets of excellence and a lot of work being done, but there's not a lot of coordination. The data analysis tends to be inconsistent and non-routine sharing, and the missing component right now in the Commonwealth within its ecosystem of alignment is in data translation, and that ability to continually assess and convey information. And really the whole goal of this, in addition to broadly addressing alignment, is to help best inform policy, strategic planning, and program development, and this being an iterative process. So this visual represents the work, and stakeholder input is what is important. A lot of this is underway, and the goal is really to strengthen this and to provide additional coordination and data translation. Other aspects of this visual represent the squares. The color-coded squares is additional detail of what stakeholders felt was really important to include in these areas. That's not to say it's not already being done, but that it needs to be, those things need to be incorporated. Want to just very briefly run through some recommendations, near term and long term, relative to COVID, wanting to take into account this impacting on, really raising the importance of this effort, as Mr. Slater mentioned previously during Tom's presentation, and really looking at taking work already underway with the governor's economic strike force effort underway to reboot the economy here in Virginia. And there's 3 working groups that are forming that strike force that the governor has established that can serve as a framework, as a way to move this effort forward in the alignment project in a low-cost manner. And they touch on data, partnerships, and overall coordination. So just briefly want to mention some of those recommendations and then really seek council's input on that to incorporate into a draft report that will be formally presented at the next meeting. One pertains to data analysis, evaluation, and translation, and the ability to provide additional tools to the data work group within the governor's strike force. Right now, there are challenges to some of that data as a result of COVID, and it would, again, further allow this kind of consistent source of data analysis and coordination and allow us to them to continue on that work post-COVID in terms of data analysis and translation that would be helpful for not just the governor's effort, but also, beyond for this effort as well. Partnerships and employer outreach. There are recommendations regarding seeking specific targeted input from employers because some of the data is challenged by COVID. For example, current unemployment information does not tie back to individual employers or industry. So trying to get a sense of things from what the industry needs, and in particular, a question to seek input on pertaining to employer input on online academic programs for reskilling and upskilling of the workforce, and what features and qualities that needs to possess from an employer standpoint, and how that would translate to academic program offerings. Again, taking this governor's strike force as a framework to improve overall ecosystem coordination. Another recommendation is once the governor's strike force work group subsides, to take a pared down version of that to form a higher education and workforce alignment task force to kind of keep the cart moving forward in a more streamlined manner, to really take a hard look at all of the work on data and partnerships and outreach and other programs that are going on, to see where there are things that are disjointed or duplicative, and where there could be more streamlined coordination, with the ultimate goal of that recommendation to then have some sort of formal agreement between members of this task force of ways to move forward and improve coordination. I think this, being a part, Chev has a role in this economic strike force that really more important than now than ever before, recognizing the need to work together and to coordinate. And I think this really speaks to this, and to be able to take this window of opportunity to move forward in that direction. A longer term recommendation would be to have this higher education and workforce alignment task force then take all of those short-term inputs from those short-term recommendations, along with a lot of the meat that would be provided in this alignment report, and take that to develop a statewide unified alignment strategy. The task force would not necessarily be the strategy, but would be all at the table to decide what looks best for Virginia to pursue as a longer term, again, low cost way to keep moving this effort forward, because it is probably more important now than ever, but perhaps for different reasons. So with that, want to open it up to any questions, and as well Ms. Webb and Ms. Radcliffe for any comments.
Do we have any questions or comments? I can't see the screen, so I don't know whether anybody's raising their hand or not. Can we get back to the screen with the individuals? There we go. Yes, Marge.
Yes, I'm just curious, Emily, when you think about—
I can't hear you, Marge. You're muted.
There we go. Yeah, just curious, when you think about the task force, obviously it needs to be a highly collaborative effort, but is there a group that's kind of should be you feel should be the natural leader of that task force effort? I mean, is that something that would be natural for Chev to take on, or is it another group better suited?
I would be curious to get council's input on what that should look like. I think, to have everyone at the table, obviously have had stakeholder input from a lot of these different entities as part of this process, but I think there's value in getting everyone to the table to talk broadly and make that decision collectively. So, but would definitely welcome and be curious to what council's thoughts are.
Emily, maybe to guide some discussion or begin some discussion, can you talk a little bit more about the governor's strike force and who's on that? Who are the representatives from?
Sure. So the governor's economic strike force is a multi-work group entity. There are 3 divisions, one relative to data, economic data, one work group relative to workforce recovery, where Chev has representation, and another for business and small business assistance, with the goal of helping to reboot the economy, as the shutdown is lifted. And the specific workforce recovery work group has hundreds of representatives, from WIBs to obviously, and is led by the governor's chief workforce advisor. It has representation from Commerce and Trade, VEDP, SHEV, literally hundreds, but really distilling that down to a core group of stakeholders, perhaps, that can represent all of those interests effectively.
And this is nothing more than my personal opinion in response to Marge's question, which I think is a really important one. I actually think that SHEV should be a part of that, but I think it's probably better housed, and this really is just my opinion, with the Economic Development Partnership. And the reason I think that is just because I feel like workforce is one of those, when Megan Healy was appointed, I think it was in recognition, she's the workforce officer for the state. I think it was in recognition of the fact that it is spread out so far, and it's a little bit of money here and a little bit of money there and a little bit of effort here, and I shouldn't say a little bit, a lot of effort, a lot of money spread around on that, and the alignment, it's obviously going to be, as Emily noted, more important now than it has been before. But I think, and Emily can comment on this if she wants, as we looked at it, sort of a partnership between VEDP and SHEV in terms of that communication, I think is important. But I think without VEDP involved in it, it might become one of those sort of things that gets swallowed up, and where higher ed is kind of going to be maybe behind where they would be in terms of workforce data and needs. And I would hate to see us being reactionary, kind of behind the 8 ball on that. So I think VEDP has to take a real leadership role. I talk to Dr. Murray about this all the time. I'm sorry he's not around and can defend himself from having this foisted upon him by me, but I think it's, and Emily, I'd love to hear what you have to say, but I think you've seen that work in other states too.
Absolutely. I would just say that as part of this project, have definitely been working in collaboration with the Virginia Economic Development Partnership. We're aware of the recommendations that will be presented today, and we'll continue to engage with them. So yes.
One comment, and I'll tell you, based on some of the experiences I've had working with Virginia Western here in Roanoke, because this is an area where we've really focused on workforce development in the area. And every institution, including Virginia Western, believed that they were meeting and educating people to meet the workforce needs in the area. But what we find is that they are teaching what they think the need is as opposed to what the actual need is. And they are furthermore not always addressing the changing need, because the need this year is going to be different next year and the next year and the next year. And so unless there is some kind of a scorecard created where the institutions actually know what the demand is, and the only way to know it is to survey the employers on a regular basis. It's not, it changes every year. And it's easier when you have large Fortune 500 companies, because you go to one person and that one person tells you what the need is of Altrail, what the need is of you name it, Newport News Shipyard. But when you have a number of very small entities that small companies that are hiring, and they make up the vast majority of the employees because they total so many, that need is much harder to define. I don't think any statewide effort is going to define it. The needs in Newport News are totally different than the needs in Roanoke, Virginia. The needs in Northern Virginia are different than the needs in Richmond, and the list goes on and on. So I think you have to have the institutions on an individual basis determining what the needs are in their areas, and there has to be someone in charge at those institutions that regularly report what the needs are, what the changes are, and how it's being addressed. Otherwise, I don't think you ever get to the problem. And I will also tell you that I had a conversation recently with a young man who's very interested he's employed by the Carlyle Group, but he's very interested in it from a standpoint of venture capitalists and how you can better address the needs for employees being prepared to perform their jobs. And as much as we think those needs maybe are being met in certain areas, the truth of the matter is they're not being met in any area of the state. And a statewide effort to do it, I think, is going to be a failed effort because of the various components of the state, which are so varied that one size fits all just doesn't work in this arena. But that's just one person's thought.
And then I think there's some sort of, we have to recognize that people may go to school in one area, but hail from another area or want to return to another area. So the data should certainly be accessible both regionally and statewide, or they should be able to check the different regions of the state. Because I do think, if you think of, somewhere like Radford, where, you get a decent amount of people coming from Northern Virginia, they want to go maybe home to Northern Virginia. I'm making this up, but, they need to be able to sort of check where I would expect where different things are coming from. I will, while I have my mute off, make one more point that sort of has occurred to me a number of times over this as Katie and Emily and I have talked about it is, I have, sometimes when we do budgeting, when we do policy decision-making, we will send people running after things to get money or to get approval or to get listed on something. And I feel like we have to be careful with this process that we work with the colleges and universities to strengthen the programs that they have that are already headed in the direction of meeting these goals. In other words, if someone has a wonderful nursing program, or if somebody has a wonderful cybersecurity program, that be strengthened, and that the communication work for that, rather than sending them in a direction of trying to set up a new program when maybe that's good somewhere else. So the cooperation is going to be, I think, really important. And then my final point is, and again, Dr. Moran and I talk a lot about this, is that I think whatever we do has to include the and I don't know what the offices are called at all the schools, and Emily and I have talked about this a number of times, but sort of the career counseling, for lack of a better term, at each of the schools, which, I think some of them are highly developed, some of them are underdeveloped, but that hits it sort of helps with the consumer information. So as a parent or as a student coming in, you can sort of communicate with them, and they can house this information that, Mr. Chairman, that you're talking about, like in this area, these are the needs, and in this area, these are the needs. So people, I think, it's great to know how to put together a good resume, and it's good to know how to network, but really the data that those organizations within the colleges and universities could provide is far more important, I think, at the end of the day, than any of the other information they could give out. So I think we have to really work in partnership with those offices at each of these schools, and have them plugged in with VEDP and with SHEV, so that they are, in real time, they understand what the needs are.
Well said.
Other comments? Katie, do you want to say something? Anybody?
No, I was actually just saying to Mary Ann, it was very well said. I think that's what we're struggling with. And how do you start this process at a state level, but how do you get it down to the regional level? And that's part of the challenge. But I think it's possible.
Okay, next item on the agenda, Peter, you want...
Thank you, Emily.
Oh yeah, thank you. Thank all of you. You want to talk about the items delegated to staff?
Sure. Let me just say a note on that last presentation too about Dr. Murray. He has got a conflict today. He's also on the board of the Virginia Port Authority, and there are a number of issues going on there today that he could not avoid. And so he expressed his regret and his strong support for the efforts that Mary Ann and that Ms. Radcliffe and Ms. Webb and Emily are leading. So just wanted to pass that along.
Yeah, I'm not fussing at him not being here. They have a very big agenda down there. He's been really helpful to us throughout this. I think Emily and Katie and I all have had a good time talking with him about it. He's been super helpful. and will continue to be, I feel sure.
We're going to accuse him of dodging the tough questions. So he didn't want to come today.
Mr. Chair, the items that are delegated to the director, these are administrative program approvals and discontinuances and modifications and organizational changes and institutional certifications, the kinds of things that you see every month. There's a lot more of them this month because we have it both from the March meeting as well as from the May meetings. So they're all listed. There's nothing in there that's controversial. I'd be happy to take any questions.
Any questions of Peter? Okay, we've moved the nominating committee to the end. Peter, you've sent me a draft that I'm not sure what it means. So it says, I will recognize you to introduce Kristen and Lee.
Okay, thank you, Mr. Chair. And you have this in your material. We've gotten some feedback from you already. This is just a preview of the meeting schedule for calendar year 2021. And I guess a couple of the outstanding questions, in addition to the dates that are presented, are whether we want to have the same locations that we had scheduled for this year that we're not able to attend. So, for instance, we were supposed to go to Radford in March. We did not go to Radford in March. We're recommending that we go to Radford in March of 21, for example. We have a meeting scheduled for Germanna Community College in July. If we're unable to do that meeting, we would recommend going back to Germanna. If we are able to have that meeting, then we would recommend going to Piedmont, Virginia Community College up in Charlottesville. So it's those kinds of things. I don't know that Kristen Lee, we need to go into a whole lot more detail. I did get some feedback from Mr. Slater on the March meeting where he has a conflict and asked whether we would consider pushing that back and have it a week later. That's something certainly we can look at. So if we can get any feedback from you right now, we'd bring this back in July for
Peter's
final approval. Just wanted to get it on the table with some of those questions. Kristen, were you going to say something? I'm sorry.
Your video froze for just a moment.
Okay.
I know that Mr. Murray has some conflicts with each of our dates next year because of his Port Authority responsibilities as well. So, and obviously almost all of this is tentative because we just don't know where the future is taking us right now.
Thank you, Kristen. So, Mr. Fralin, any comments now or give them to us via email over the next week or so? We'll revise this. We do need to get with Dr. Murray and see what's going on with the Port Authority. So there might be some juggling around that we get back out to you prior to July.
Okay, well, we'll take this up at the next meeting then. Most of you probably don't know, but Peter's contract is structured in a fashion that we are scheduled to review his contract at this meeting and to make a recommendation as to how we're going to address a future contract. And due to first of all, the freeze of all salaries by the Commonwealth, and second of all, the uncertainty that we're all experiencing, I would like to recommend that we extend his current salary until September and that this salary be reviewed at that meeting and his contract be reviewed at that meeting, if that is agreeable with everyone.
I second that.
Okay, I would have made the motion and Marge would have made the second. And is there any further discussion? Okay, roll call.
Mr. Chair, I'll just acknowledge receipt of that recommendation and say that I agree with it. Thank you.
I should have said that in the beginning. Okay.
Chairman, we going to do a roll call vote.
Yes, do a roll call vote, please.
Mr. Ampey?
Aye.
Dr. Adkins? Ms. Connolly?
Aye.
Ms. Harker? Was Ms. Harker on? Mr. Fralin,
Aye.
Mr. Holloman,
Aye.
Mr. Light,
Aye.
Dr. Murray, Dr. Murray,
Aye.
Ms. Radcliffe,
Aye.
Dr. Ramsey,
Yes.
Mr. Slater,
Aye.
Ms. Webb.
Aye.
Ayes 10, no 0.
Motion carries. Okay, and next item on the agenda is receipt of public comment, and Stacy Gordon of the Partners for College Affordability and Trust has requested to speak. So I'm not sure how we do that on Zoom, but Peter, will you and your staff figure out how to do that?
Yeah, Mr. Chair. Stacy, I think you're queued up to speak.
I'm not sure if you can see me, but I hope you can hear me. Good morning, Stacy.
Yes, we can hear you.
Can you? Great. With Partners for College Affordability and Public Trust. This past session, the General Assembly tasked SHEV with developing a plan to conduct an institutional survey on cost aggregated by academic discipline to enable better cost containment and better return on state investments. While this plan is meant to be exploratory only, I strongly encourage the Council to support the future implementation of this plan. While the Council does not currently collect financial data by program or discipline, the new and unforeseen challenges higher education faces today have made this type of cost survey more relevant and important than ever. The level of financial data is beneficial when it comes to evaluating the effectiveness of institutional spending to optimize student outcomes and support institutional goals. A handful of states currently conduct and publish this type of data and do it well, including Florida, Illinois, and Minnesota. The COVID-19 pandemic has left Virginia colleges and universities scrambling to rework their 2020-2021 budgets to account for drastically reduced revenue projections. Fortunately for Virginia's students and families who are facing financial hardships of their own, many of these institutions have already made the commendable decision to account for these budgetary shortfalls without increasing tuition. In an about-face from the historic norm, colleges and universities are now putting their students' financial well-being ahead of the institution's own. While holding down prices in a time of economic hardship is something that many in higher education previously claimed to be impossible, these decisions prove that where there's a will, there's a way. Institutions now face difficult decisions and much tighter budgets. Moving forward, they'll have to better prioritize spending and find new ways to streamline and reduce cost by reviewing their budgets line by line, dollar by dollar. Understanding operational spending at the program and department level is more important now than ever before and would help institutional leaders in allocating their financial resources at a time when revenues and state support are uncertain. Conducting an annual institutional survey of department level cost would allow the Council to weigh cost against student outcomes data, which provide a clear picture of ROI to help guide these cost reduction efforts. While such a deep dive into cost, revenue, and outcomes is not an easy lift, we believe it to be important to the future of public higher education in Virginia and encourage the Council to make this a legislative priority. Thank you.
I'm sorry, were you cut off, Stacy? Or did you?
I was done. I'm sorry.
Okay, I'm sorry. Okay, well, thank you for those comments. And the next item on the agenda, well, first of all, are there any questions? Anybody have any questions of Stacy? Okay, next item on the agenda is report of the nominating committee. And Carlisle, could you please give your report?
Sure. You can hear me now?
We can.
Okay, great. If you will check in your board agenda book, it's on page 123. And you see the background there. I won't read all that, obviously. A summary of major elements, but as you know, the council bylaws state that we annually elect a chair and a vice chair and appoint a secretary until their successors have been elected. And so Dr. Rosa Atkins and Dr. Bill Murray and I have conferred individually with all of our members, council members, and we are prepared to present our recommendation for the officers for 2020-2021. And so, Mr. Chairman, I'll present this in two ways, Bill, unless you want to do it.
Go right ahead.
One, we'll do the election first. So we are recommending, after conferring again with all of you, that Marge Connolly be elected as our chair for 2021, and Mr. Tom Slater be elected as the vice chair. That's my motion.
Second.
Is there any discussion? Are there any further nominations? If not, we'll have a roll call vote.
Mr. Ampe?
Aye.
Dr. Atkins? Ms. Connolly?
Aye.
Ms. Harker? Ms. Harker, by the way, did text me and said she's on, but I guess we're not hearing her. Mr. Fralin?
Aye.
Mr. Holloman?
Aye.
Mr. Light?
Aye.
Dr. Murray? Dr. Murray?
Aye.
Ms. Radcliffe?
Aye.
Dr. Ramsey?
Aye and yes.
Mr. Slater?
Aye.
Ms. Webb?
Aye.
And I will confirm with Victoria, but that would be, if she did vote like she said she's been, it would be ayes 11, no 0.
Okay, the motion carries. You want to proceed?
Yeah, the process also involves, as you know, the appointment of council secretary. And so we are recommending the appointment of Katie Webb to serve as council secretary for 2021.
Second.
Any discussion or any further nominations? Well, roll call vote, please.
Mr. Ampe?
Aye.
Dr. Atkins? Ms. Connolly?
Aye.
Ms. Harker? She did confirm she voted aye. Mr. Fralin?
Aye.
Mr. Holloman?
Aye.
Mr. Light?
Aye.
Dr. Murray? Dr. Murray?
Aye.
Ms. Radcliffe?
Aye.
Dr. Ramsey?
Aye.
Mr. Slater?
Aye.
Ms. Webb?
Abstain?
Ayes 10, abstentions 1.
Okay. First of all, I want to thank staff and all the members of council, Peter particularly heading his staff, for all of your support over the last 3 years. You have been tremendous. I think that we have made a lot of progress with our share of coordination of the both public and private institutions, but mainly the public institutions, because that's mostly what we coordinate, although we are very supportive and hopefully helpful to the private colleges as well. We've accomplished refinements to our Virginia plan, which I think is an excellent plan, and one that I believe probably is being emulated by other systems throughout the country. I like where we are. I think that things look good for the future, in spite of the pandemic that we are experiencing. We obviously have a number of challenges facing us, which would be facing us regardless of the pandemic, but that adds a huge number of challenges for the future. My guess is that higher education will be changed as a result of this pandemic. Hopefully, we will learn from it and we will be stronger and better after it's over. I've heard people compare it to the reaction of the country at the end of World War II, when as a nation we came together and we became much stronger, and higher education flourished better than any other time in the history of the country. And so hopefully we can do the same thing after this pandemic. I can't think of anybody better than Marge to lead this organization in the future. She's had tremendous experience as an executive in one of the major Fortune 500 companies in the nation. She has been an interim president at one of our universities and is well qualified to lead Chev to even greater heights. And she has a great council surrounding her and a great staff comprised of Peter and his organization. So, Marge, I can't think of a better time for you to be here. And best of luck to you. And we'd love to hear comments from you.
Thank you. Thank you. I appreciate that very much. And I guess, first of all, I just want to say thank you to you, Haywood, for your just really great leadership over these past years. I think you've helped us do a number of things. You've really brought focus to the educational needs of our rural communities. And as an example, the need to approach research in a different and better way, the importance of aligning our educational programs to our workforce gaps, just to name a few. And you've brought some really great speakers to us as well, which I think have been both thought-provoking as well as educational. And just overall, I think you've really raised the capacity and the capability of the council as a whole. And so thank you very, very much for all of your hard work and your leadership. So a virtual round of applause.
Thank you. Thank you.
The second thing, I just want to thank my fellow council members, for their trust and their confidence. And I commit to you that I will work hard in a very, very inclusive and collaborative way, just to really maximize the positive impact that I think this incredibly talented group of people who are incredibly passionate and committed. And, I mean, both us on the council, but also staff, the positive impact that we can have on our institutions, on our students, and the Commonwealth overall. I think we've got a good core plan, and we did have some really great traction, but obviously we're going to need to do some serious rethinking and reprioritizing about our efforts over the next few months. So I look forward to joining you in that effort. And then last, just a couple of thoughts on the role of Chev overall. The organization, the agency plays really a number of different roles, right? It's an administrator, it's a communicator, it's an advocate, it's a developer, an implementer of policy. But, when I think about all of those activities, underneath that, there's really three, what can be really powerful tools that I think Chev often is able to use to make things happen. And that is the role of being a convener. I think the second is the role of being a coordinator. And then perhaps most importantly, being a trusted provider of objective expertise, information, and analysis. And, I think it's really important to note that this trust and credibility that Chev has earned is not just because of the quality of the staff, although that is very high. And obviously, it couldn't achieve that degree of trust and credibility without it. But it's also because of the experience and the character of council members. And, I am just incredibly pleased that at this important time, we do have such a strong group, because, we're going to have to bring every single one of these tools to bear in order to help higher education in Virginia, not just address the current situation, which is tough enough, but to come out of this even more equitable, more effective, and more resilient. And I think, yesterday's discussion with the private school presidents, I think was a great example and a good expression of the need for all three of these things to be present to an even greater degree. And I am very gratified that we have an agency like Chev to be able to provide that. We know this is a complex situation. It's going to require input from a wide range of constituents. And I think Chev can play a leadership role in convening those diverse group of voices and make sure that all that input is heard and considered. We know it truly is a system, right? We know that actions by one have an impact on virtually every other. And so I think, again, providing the coordination that's appropriate to ensure that those impacts are reasonably managed, I think is a vital role. And then, we know for sure that data and analysis and objective perspectives, the ones that are based really not on just ideology, but the actual interests of students and institutions and the state overall, are going to be essential to ensure that all of our stakeholders can make the absolute best decisions possible. So, the challenges are big, but the opportunities are even greater. And I believe that we've got the talent and we've got the commitment to rise to this occasion and continue to drive the progress that we've seen toward becoming the most educated state in this country. So thank you, and I look forward to working with everyone.
Thank you, Marge, for those comments. And before we adjourn, I noted that I skipped, is there any old business to be considered? Any new business? I also was asked to note that these terms begin on July 1 of 2020 of the new officers. So thank you all for attending, and our meeting is adjourned. Thank you.
Thank you all.
Thank you.
Talk soon.
Thanks.